America. This country where everything is different. Baby, I know say you go so I go take you to America. And you home America. And you dance America. Baby, I know say you go so I go take you to America. From Africa to America. From Africa to America. This country way everything be different, everything not different, yeah. This country way everything not different, everything not different. From the road to the food to the street to the house, yeah. Everything be different, everything be different. Everything be different. From the road to the food to the street to the house. Everything be different. Everything not different. In this country, you better talk, yeah, you better talk, yeah. These my tickets, yeah. You could tell us you do your wallet, yeah. In this country, yeah, you better stop me, yeah. These my words, yeah. You could tell us you do your wallet, yeah. In this country, you better stop me, you better catch me, you better stop me. I go down and day, I did my ticket, yeah. In this country, you better stop me, you better miss my wallet, yeah. You did my wallet. In this country, you better stop me, you don't trust me, it's my ticket. You go tell and say, you did your wallet. This country, you better stop me. You don't want this, me, I'm on ticket. You did all of this. The golden endless one. Na 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 na, yeah, yeah. Baby, I know say you go home, so I'ma take you to America. My new home, America. My new home, America. Baby, I know say you go home, so I go take you to America. My new home, America. My new home, America. Baby, I know say you go home, so I go take you to America. My new home, America. My new home, America. Baby, I know say you go home, so I go take you to America. My new home, America. My new dance, America. 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 This country where everything is different. Baby, I know say you go so I go take you to America. You home America. You dance America. Baby, I know say you go so I go take you to America. From Africa to America. From Africa to America. This country way everything be different, everything not different, yeah. This country way everything not different, everything not different.
Network. My name is Kevin Akobedu Taylor. This is the extended version of With All Due Respect. Ladies and gentlemen, welcome to the show. Welcome to the show, the family. Welcome to the show, the new family members. This is the show that you have to tell a friend that Kevin Taylor and the Ghost team are live. We're here today to talk about Ghana. As you know, we started very, very early. We are on time, right? Yes, we are on time because today we will be moving straight to watch ex-President Mahama's what does he call it? A digital conversation on Ghana's COVID-19 situation. My producers are telling me that if it starts exactly at 8:15 Ghana time, 4:15 US time, they will try and send us the feed so that we can watch it live on Loud Silence Radio and TV network. It is important that we listen to ex-President Mahama because we have talked about health. We talked about infrastructure. The president came out the last time. We all watch it on this network. So we also have to give him that audience and listen to what he has to say when it comes to health and infrastructure. So that's why we're here very, very early today to do justice to that. So if you're watching me live, I would like to say good evening, wherever you are. Good morning, good afternoon. My name is Kevin Ekobe Detailer. This is the extended version of With All Due Respect. You can watch this show on 4 solid platforms. 4 solid platforms. On Facebook, 2 platforms. Loud Silence Radio and TV Network. Loud Silence Radio and TV Network. On Facebook, you can also watch this show on With All Due Respect platform. Like the page, follow the page. You'll get notifications every time we live. Also, you can watch this show on Twitter, Loud Silence Radio and TV Network. And on YouTube, go there and subscribe, Loud Silence Radio and TV Network. This is a very packed show. Today's show is very packed indeed. We're talking about COVID-19. The numbers we see now is 2,074 confirmed cases, 212 recoveries, and 17 deaths. 17 people have died from COVID-19. We have 2,074 cases in Ghana today. This is terrifying. This is scary. And if anybody thinks that this is a joke, we have to visit the books again. We have to rethink as a nation and strategize towards this COVID-19 pandemic. So, as you can see, we're going to quickly do something. Producer, if he's ready, what we're going to do is we're going to do a quick social media segment, less than 10 minutes. And after that, we'll try and see if we can pick the feed from John Dramani Mahama's Facebook page and show this live on our network. After that, we will come back, delve into whatever he talked about briefly, and then go into today's editorial. So it's a packed show. We need to analyze these politicians. Now, he's also going to come out and speak on COVID-19. He's going to talk about infrastructure. He's going to talk about health. We just need to hear what ex-President John Dramani Mahama has to say in all this conversation. So stick and stay. You're going to be watching him live here on this platform. We gave the president the same platform when he addressed the nation. So we are not leaving any stone unturned. We're going to be making sure that we fact check all these politicians. If they lie, we're going to be talking about it. If they don't, we also talk about it. So this is the platform you have to be. Ignore the others. The others won't tell you the truth. The others will try and garnish the issues. But here, we're going to be straightforward with you and tell you the truth. So, producer, if you can give me the signal, we can go straight to the social media segment and then take care of it. I can give you some space if you want, producer. Yes. So, the first social media story, in fact, it's so shocking. I didn't say hello to the family. If you're on Facebook, on YouTube, if you are everywhere watching us, I'd like to say good afternoon, good morning, good evening to the family. I wish I could mention names today, but we're trying to do things quickly to get to Mahama's address and then also come back and do an editorial and discuss Ghana. So I know the family will forgive me today for not saying hello to them. Let me see if I can do 1 or 2 of the hellos. Yeah, we have like 3-4 minutes. Let's see. Isaac Kran is here. Amina is watching, like Francis Otu, Mubarak, Mujid is also here. So let's see on YouTube. I'm saying hello quickly to a few people. The family know that today is a busy day. Okay, the family on YouTube, who is here on YouTube? Let me just say hello to the family, and then we can do the social media segment for 6-7 minutes. Then we can go live and pick John Dramani Mahama. He's speaking on a few things today. Santana Mohama is here. Richard Kofiago is watching me live on YouTube. Richard Kofiago is back. Saki Nathaniel, Della Ago, Tina Volta. I know your class prefect, Sandra Hetika, might not be here, but I'd like to say, wherever you are, Sandra, have a good evening. And when you show up, let me know that you've showed up on YouTube. So, family, I'll be back to say hello to you fully. Let's do this. Producer, let's do some social media. Yesterday we talked about the floating bridge. I talked about a lot of things that are going wrong in Ghana that mainstream media has ignored. I talked about Asla Usu, her arrogance and the way she's acting as a minister, and then how disrespectful she is to her constituents. That's her constituents. I'll get it back to you. So the first story is about her. In fact, it is shocking to hear her speak today on this issue. And if my producer is going to show you guys are going to see it. She said that Choco Boys, Asla Usu today said she was talking to parliamentarians. She said, after Parliament, she met the press, and she said, Choco Boys intentionally plotted the collapse of my floating bridge. Asla Owusu. So it shows how, you see, there's no remorse in her language. This woman has shown that she's not matured enough to be a politician now. You put together a shoddy job, we talk about it, instead of you coming back to humbly to tell the people you are sorry and that you are actually not competent and that they have every right to criticize you. You come back to attack the same people you have deceived, the same people you have stolen money from, telling them you are going to build a bridge for them. You turn around and say, Choco people are the people sabotaging you. This is a whole story I would do, because this is an insult to people on Choco, to be very honest with you. Asla Owusu is not matured enough. She's too weak-minded. You give your platform to come and explain yourself, you turn around to come and insult people in Choco. By people in Choco, we will talk about this. In fact, after Mahama's speech and all that, we might come back to this issue. The next story on social media is, let's see, producer. Yes, my friend Kennedy Japan also went to Happy 98.9 FM, and he says, don't dare me. Ken Japan wants Opuni. So Kennedy Japan is always warning people. But no one should dare him, but he has nothing. Today, he's trying to, divert attention. Today, whatever he's trying to do now is he's paying media houses to grant him interviews for the president to notice him. President Ekufuado, Kenneth Furiata, they've all realized that Kennedy Japan is a lying fool. So they don't even allow him to talk to the president. His problem right now is Nana Addo Dankwa Akufo-Addo doesn't want to talk to him. So he's doing everything possible to get the president's attention. You come and dare, Opuni shouldn't dare you. When did Opuni talk? Today, you want attention because you know that Opuni's story is sensitive. Let me go and talk about it. You are paying your way, and journalists are taking money to give you interviews, grant you interviews. This is how weak and low our politics has become. You remember just Tuesday or so, he went to the Jubilee House to donate some PPEs to Jubilee House. You believe the president did not meet him. The president was in the office. The president was there, but the chief of staff received this. So, Kennedy Japan, the president doesn't want to meet him. No matter what he does, he has become like a cockroach in the MPP. They know he's a thief, he's a liar. So all that he's doing, Opuni shouldn't dare you. Who cares? All right. The next story is also was published by City News. Isaac Adongo slams senior minister over Unipass challenges. This Unipass issue and GCNet or whatever, Ghanaians are confused. The media is not taking their time to break it down for people to understand this issue. In fact, this weekend I will be breaking the Unipass issue to Ghanaians. I've done my job. We have taken our time. We have looked into the issues. We are going to start it from the beginning and end it for you people to know who are behind this issue and why this is happening to Ghana today. Over 24 hours, 48 hours, we've not received anything at our ports. So I'm going to take my time over the weekend and break it down for Ghanaians to understand this Unipass, GCNet. You are using too much grammar. We will make it simple for Ghanaians to understand. The Ghana report also published a story. Election 2020 says EC must brief Parliament on preparations. Okay, that's the minority leader, Haruna Idrisu, just told Parliament that they expect the EC to come in and tell them how prepared they are going into election 2020. And I think that is a very, very valid question. The EC needs to come out, give us a schedule, tell us what they are doing, what their plans are, and how far they have gone when it comes to preparations towards the 2020 general elections. Because the EC is not telling anybody anything. The only thing they say is, we are having meetings, we are recruiting people. We want to have a clear understanding of the EC schedule ahead of the 2020 elections. Kojo Yanka also posted something on Facebook. And he said that available information tells that Noguchi Lab will need $3 million to develop a vaccine. Can we borrow from the cathedral account and pay after we have dismissed COVID-19? He is asking a question, and I saw a lot of people insulting him and all that, but this is a valid question. Can we borrow $3 million from the 100 million cathedral money and save Ghanaians? Because at this point, if the president thinks, this is funny, right? We have cathedral money sitting there, people are dying. And you tell me I shouldn't criticize the president. You tell me not to criticize the president? So Kojo Yanka is asking a simple question. Can we borrow $3 million from the cathedral money? The cathedral that we built, we sack judges, they are homeless now. Can we take some from the cathedral money and use to fight COVID-19? Because Noguchi will need just $3 million. Just $3 million. Cathedral has 100 million and over sitting there. So we can take some of God's money to do God's job. All right. The next one is I saw this on social media today. It's funny. Position, name, Minister of Food and Agriculture, Minister, that's the Honorable Dr. Owusu-Friye, Minister of State, Honorable Dr. Jelle Nura, Deputy Minister in charge of annual crops, Honorable Dr. Sagre Bambagi, Deputy Minister in charge of horticulture, Honorable George Udru, Deputy Minister in charge of perennial crops, Honorable Kennedy Osenyako. One ministry. 1, 2, 3. They have 5 people handling one ministry. What the hell is wrong with Ghanaians? And we don't have a problem with that. Producer, if we're good, you can give me a signal, and I'm going to cut this short for us to go straight and pick the feed. So anytime you think we're good, just give me a signal, and I'm going to stop talking. Then we can pick the Mahama speech live. Can you hear me, producer? Okay, so we have to keep going. Producer says he's not live yet. The next one is, the story was reported by citynewsroom.com. Citynewsroom.com. Now, one district, one factory. B5 Plus Company. B5 Plus Company appeals to government for adequate water and power supply. So, you people, we don't even get water to drink in Ghana. You want water and power. You people, B5, one district, one factory. These Chinese or Taiwanese people. You light the crown, you have given it different name. Doomson and because say Doomson. You want water and you people, Jack, you people for be smart. You have to come out and speak and stop the concert. People should come out and speak. They say they want water and power supply. So the one district, one factories are not getting water and power supply. This one, we will talk about it later. So these are the headlines in the news today. Now there's a reminder on social media, especially on Facebook. I saw this poster, which I think is quite interesting. It says, reminder, NPP Manifesto 2016, page 34, item G. It says, in quotes, and I quote, I quote, we will upgrade all existing district hospitals. Where they do not, we will establish one. So, this is the NPP Manifesto, page 34, item G. They will upgrade all existing district hospitals. Where they do not, we will establish one. So they said they were going to upgrade all the district hospitals, and also where they think there's no district hospital, they will put up one. The question is, how many district hospitals have been built in the last 4 years? How many district hospitals have been upgraded in the last 4 years? These are the words of the NPP, and it's in our manifesto, page 34, item G. If you want to know where it is, go get the NPP manifesto. I have one, and read page 34, item G. Now, the next one is a story, which is a very, it saddens me to read the story, but we have to do it. Now, it was reported by Joy News. It says, child dies of COVID-19 at Kolebu. 3 units condoned off for disinfection. A child just died at Kolebu Teaching Hospital and from COVID-19, and 3 of the units have been closed down for disinfection. But this government says that they will provide the EC lots and lots of PPEs so that they could do registration. But people are dying. People are dying. Seriously, kids, they are all dying every day at Kolebu. And then the president is only thinking about giving all the PPEs that were given to them by the Americans and the Chinese and John Mahama and all the people, Kennedy, Japan, they distribute all these PPEs. You don't know where they are. They are saving all these PPEs for the EC to use during the registration, so that EC will come and say, oh, we have 1 billion PPEs. So anybody who comes and get in a queue will get mask, nose mask, or gloves or whatever. This is where we are as a nation. We're live. All right, let's go live and watch John Dramani Mahama on health and infrastructure.
Protocols of hand washing with soap and the running water, use alcohol-based hand sanitizers, ensure physical distancing, and wear protective masks. An update by the Ghana Health Service puts Ghana's confirmed cases at 2,074, with 212 recoveries and 17 deaths. The cases are spread across 12 of our 16 regions, with Greater Accra being the epicenter with 1,795 cases. Clearly, we have passed the containment phase of the disease and are currently having to fight against a community spread. While the official statistics are what we have to work with, it is clear that actual cases may be far more than have been captured because of constraints in testing capacity. Unfortunately, government has still not come out with any comprehensive plan detailing its strategy in the coronavirus response. As the President implied in his last address, our destinies are in our own hands. He urged Ghanaians to exercise self-discipline by respecting the social and fiscal distancing guidelines and wear masks to avoid infection. Our healthcare workers are among those with the highest risk of contracting the virus. There are continuous reports that basic protective gear, temperature readers, and other essential items that the President says have been acquired to enable them fight the disease have not been made available to the health facilities. Reports of health staff having to buy their own PPEs have been filtering through from various parts of the country. It is difficult to fathom the inaction of government in this respect, considering the access it had to almost 8 billion Ghana cedis within weeks of the pandemic. I recently listened to the testimony of a patient who had recovered from the illness, and it is obvious that social stigmatization of persons who are known to have been infected by the virus has begun. Public education and awareness about the nature and transmission of the disease in all the major languages of Ghana has unfortunately been unsatisfactory. This is reflected in the lack of respect for social and physical distancing and other preventive protocols, despite the exhortations by the President. The advent of the COVID-19 pandemic in Ghana has also provoked quite a useful debate about the need for a more robust and effective health system. It has become obvious that the system must not only be responsive to the immediate and long-term health needs of our people, but also withstand emerging global public health challenges, such as this novel infectious disease we're facing. It has been widely acknowledged that some of the critical investments and I'm referring to the National Democratic Congress administration, in which I was vice president and later president, made in the health sector have proved extremely useful and enabled Ghana lessen the impact of this pandemic on our people and our nation. My brothers and sisters, this acknowledgement bears out the vision and clear thinking that went into the massive investments we made in the health sector. There were uninformed and snide remarks at the time, some questioning why many such health facilities were being constructed. We were acutely aware, however, that these investments were necessary to modernize a very fragile and weak healthcare system. What we had at the end of 2016 was not the optimum, but great gains had been made. And so if government had diligently continued and added a few more beds and enhanced medical equipment, our situation would have been better than it is today. The pressure on the existing health facilities and our health personnel would have been much less. We pumped in the needed resources to establish health facilities at all levels, from quaternary, tertiary, regional, and district hospitals to polyclinics, health centers, and CHIPS compounds. These had the effect of opening up the health system and making healthcare accessible to all, including unserved and underserved communities in even the remotest parts of our country. There were a number of these health facilities which were not completed by the time we left office, and only required a little more effort to complete. The natural expectation, therefore, was that the succeeding government will swing into action and have them completed and press on to make even further investments in the sector to make the goal of health for all a reality sooner than later. It was also thought that those that had just been completed at the time will be operationalized for use by the Ghanaian public, in whose name and for whose benefit the facilities were established in the first place. Governments, citing very strange reasons, differed in the operationalization of even those hospitals that were completed. The government also failed or refused to complete several key projects that we undertook, not just in the health sector, but also in the roads and education sectors, among others. A clear case of putting politics before the people. A classic case in point is the University of Ghana Medical Center, which I had the privilege of inaugurating in December 2016, and which was ready for use at the time. After an avoidable but protracted tussle with the University of Ghana authority over the management of the facility and misleading claims by the health minister that the facility did not have a standby power system, it had to take a one-man demonstration and the COVID-19 pandemic for only parts of the hospital to be opened to treat patients. This is a 650-bed Tier 4 hospital that can render cutting-edge services to our people. Today, that facility's ICU, intensive care unit, which was left abandoned for more than 3 years, is saving lives, serving the very purpose for which it was built. Because of the advanced nature of the equipment and facilities in the University of Ghana Medical Center, health staff were sent to Israel for specialized training to come and operate that hospital. These staff have still not been put to work and are currently dispersed all across our health system. The training they received has unfortunately been underutilized. Similar delays have been experienced with the municipal hospital at Ofanko and the Kaswa Polyclinic, both of which we constructed as part of the community development component of the Awoshi-Pokwasi Road and the Kaswa interchange projects. 2 years after they were completed, it had to take intense media and public pressure to get them opened. All this was at a time when the no-bed syndrome had resulted in a sad situation where patients in need of urgent medical attention were turned away from hospitals because of congestion, resulting sometimes in avoidable deaths. Ghanaians died when hospitals completed and ready with a combined capacity of 900 beds had been left standing idle. But for the deliberate slowdown of operationalization of the University of Ghana Medical Center and the Bank Hospital, the unacceptable no-bed syndrome would not have claimed these precious lives. Talking about the Bank Hospital, the rather curious case of that hospital and the International Maritime Hospital cannot escape attention. These are ultra-modern, world-class hospitals built with public funds and yet have either remained shut or are underutilized. Particularly worrying is the abandonment of some major health facilities that had reached an advanced stage of completion by the time we left office. I refer specifically to the NMS project, under which 7 fully equipped 120-bed district hospitals with staff accommodation commenced in 2013 at Dodowa, Kumawu, Fomena, and Abetifi. By early 2016, the Dodowa Hospital had been completed and commissioned into use, while those at Kumawu, Abetifi, and Fomena had reached various advanced stages of construction by the time I left office in January 2017. Whatever the challenges with these projects, they should not have been left abandoned and left at the mercy of invading weeds and reptiles, and in some cases, been affected by bushfires. Chiefs, queen mothers, and residents of these communities have on many occasions had to beg and appeal to government to allow the contractors to return and resume work, but all to no avail. And what has been the cause of the abandonment and stoppage of work, despite the availability of funds for the continuation and completion? Fruitless and malice-driven value for money audits that yielded virtually nothing. Another case in point is the almost 1 year delay of the Eurojet, the Invest Hospital projects. These projects involved hospitals in Tepa, Nsoko, Trifopraso, Salaga, Konongo, Kumasi Regional Hospital at Sewa, and a new military hospital at Afari in the Ashanti region. For 1 year after the new government came into office, these projects were stalled because the project managers were asked to pay duties and taxes on material and equipment at the port, even though they had a valid exemption granted by the Parliament of Ghana. This situation robbed the people of Ghana of the timely opportunity to access quality health care, which would have been offered in the catchment areas these facilities were to cover. But for the inexplicable failure to continue these projects, we would have been in a much better position to tackle this COVID-19 pandemic across the country with a more robust health system. In addition to more health workers being employed, they would also have had a more congenial environment to offer their critical services, and our people would have had a more dignifying place to seek health care. While even more investment is required to augment the existing health infrastructure, it is important that the plan to do so is credible and clearly thought through. What we should avoid is knee-jerk promises that appear reactive rather than the product of critical thinking and a well-coordinated response to an existing or emerging problem. Ladies and gentlemen, the reaction of the public to the President's promise to construct 94 new hospitals in 1 year is understandable, considering his rather tall list of unfulfilled or poorly implemented promises from yesteryears. I believe in a well-thought-out and forward-looking agenda, which ensures further strategic investments in our health sector to meet contemporary and future challenges. This must take into consideration the grave threat posed by global pandemics like COVID-19, SARS, MERS, Ebola, amongst others. It is in furtherance of this vision that I announced on my visit to the Western North and Bono East regions in July 2019 that if elected, God willing, in December 2020, I'll establish a regional hospital in each of the 6 newly created regions. I also indicated that I'll ensure the provision of a modern health facility in each district that currently does not have one, as part of my Health for All agenda. All districts would receive a modern health facility. These facilities will range from polyclinics to district hospitals. Proper planning requires that we take into consideration location, demography, population, and health needs of the area before siting a health facility. There are, for instance, currently districts with well-functioning hospitals owned by faith-based organizations. In such cases, we will partner with these organizations to upgrade their hospitals, to improve their services, rather than duplicate it with another public hospital in the same district. And in districts where there already exists a polyclinic or health center, that is overstretched by population growth, we will upgrade them to the status of hospitals by adding infrastructure and equipment. I reiterated these in my Facebook Live session late last year. Furthermore, I re-emphasized this commitment in 2 public engagements since the outbreak of the COVID-19 in Ghana. The first was when I donated PPEs and other medical supplies to several hospitals across the country in a bid to save health workers from being infected. Similarly, I reiterated my vision to build a robust health system when I presented food items to 20,000 households during the lockdown period. On these 2 occasions, I stated the need for greater investments in healthcare to ensure a total state of readiness at all times to respond to pandemics of the nature we currently face and other disaster situations. And I promised to start and complete phase 2 of the Greater Accra Regional Hospital, that is the RICH Hospital, to expand and double the capacity of the 37 military hospital, to construct 2 international standard infectious disease centers, and establish 2 additional international research centers with capacity like the Noguchi Memorial Institute for Medical Research and the Kumasi Center for Collaborative Research in Tropical Medicine. I've also proposed to establish a national infectious disease response plan that will enable us to prevent the entry of such diseases into our country, as we did in the case of Ebola. In all these, let us not forget, the ultimate goal is to build a health system which is ready and able to protect our citizens and health workers against current and emerging threats. And this is the reason why protective equipment and related logistics will become a permanent feature of our response plan and must form a significant part of our strategic medical supply stock. These projects will be carried out using contemporary financing models that bring down the cost of such equipment, such as leasing, which has proven cost-effective and is in use in a number of advanced healthcare jurisdictions. In his last broadcast, and indeed in previous ones, the President echoed many of the ideas and policies I have previously outlined. It is gratifying to note that he is listening. Any addition to our health infrastructure is ordinarily welcome, but it is regrettable that it had to take COVID-19 to jolt him into this reality about the importance of such critical investments in healthcare. That said, the fundamental difference between our 2 respective positions is that I come to the table with an established track record of actually delivering many of such projects with less resources than he has had in the last 3.5 years. Fellow Ghanaians, the NDC comes to the table with a clear plan of modernization of our healthcare system. This plan considers global best practices and will have features that guarantee equitable access to quality healthcare for all Ghanaians. I've taken due notice of concerns expressed by the Ghana Medical Association about the availability of health personnel to man these new facilities. Here too, the NDC has a plan. I announced in my interaction with you last December that we had concluded a public sector human resource gap analysis to guide our employment policy going forward. The analysis shows that for Ghana to reach the universally acceptable optimal level of health delivery and bridge the yawning gap between health professionals and our population, the Ghana Health Service would require an additional 86,000 health personnel. If we prioritize properly and reduce the large army of ministers and other political appointees, we could probably create more space to accommodate some of our nurses and doctors who are sitting idly at home. We've done it before with the limited resources available to us. My administration employed the largest number of health professionals in recent times. Under my watch, 41,418 nurses were employed by the Ghana Health Service. We increased the number of nurses from 11,125 in 2012 to 52,605 by the time we left office in 2016. And this can be verified from the facts and figures publication on the website of the Ghana Health Service. Let me assure health workers one more time, you deserve better, because the gains of the single spine policy have been eroded. My brothers and sisters, a major plank of our health plan will also be far-reaching reforms in the healthcare financing. We shall remove all the obstacles which prevent citizens from accessing primary health care and relieve the NHS of the pressure from recurring and widening financing gaps, which threatens its sustainability going forward. This only represents a snapshot of my vision of a modern and responsive health system for Ghana. As I've said before, the next NDC government will prioritize government spending in favor of the well-being and welfare of Ghanaians, as opposed to the comfort of only the upper echelons of society. Healthcare will be one of the major priorities of my government, if elected. Through healthcare, we shall employ more people, both in the health sector and in the manufacturing sector. COVID-19 has proven that we cannot continue to rely on imports. In addition to an improved healthcare system, the biggest concern in the COVID-19 era will be how to rebuild our economy. The pandemic has exposed the extent of inequality in our society, and we must do something urgent to address it. The economy has been projected to come under severe stress with very low growth, high deficits, unsustainable debt levels, and a depreciating currency. This means the excruciating financial emasculation that Ghanaians suffered before the coronavirus pandemic is set to worsen. In the light of this, it will be catastrophic if deliberate steps are not taken to grow the economy for the benefit of Ghanaians. What is your assessment of where we are now? What is the Ghana you look forward to post-COVID-19? I do have some good answers and ideas. I've been meeting with my working group of experts and professionals on the economy, a group that is chaired by Professor Kwesi Botwe. Our next conversation in due course will discuss some of these options we have come up with. I want to repeat that I cannot thank all of you enough for the interest and commitment we all have towards building a formidable country that provides equitably for its citizenry, especially in such times as this. And so let me thank you once again, and I will now go through your questions, your suggestions, your criticisms, and your contributions. I thank you.
Are you still for what?
From Ekuya Owusua Nemaku. Ekuya, thank you very much for your question. As I said, there's a gap in terms of the ratio between doctors and patients. Indeed, there was a time when in the whole of the Upper West region, there were only 12 doctors serving in the region. And so it means that there's space to increase the number of health personnel in all these areas. The way to do it would be to expand training. And so we have the possibility, and we have the plan,
or something.
if we get elected, to look at the University of Health and Allied Sciences and expand the training of medical professionals in that institution.
Okay.
And then also to look at the University of Development Studies and expand the numbers of doctors that we are able to train in that institution. There are other means of doing, fast-tracking the training of doctors. For instance, we have the biomedical science students who do 4 years in university, who can transition to do a medical degree, a fast-track medical degree in 4 years. And so if we get some of these biomedical students who have finished with their first degree onto a fast-track medical degree, we can turn out several more doctors than we are currently doing. And so there are many, ways in which this can be done. And I believe that it is necessary to do so if we are to bring health to the doorsteps of all our people. From Mohammed Zaidan Imam, Your Excellency, were there funds for the construction of these facilities? Were there funds for the construction of these facilities enough for its completion at the time you were leaving office? Yes, these were facilities that were designed based on funding agreements. And so they were costed, and based on the costing, the funds were raised. Most of these were based on external loans that we contracted. And they had been approved by Parliament, and actually work had begun. So there must be no reason why the funds were not available for completion of these projects. I believe the funds were available. I think that in most cases, it was unnecessary investigation of the projects, unnecessary and prolonged due diligence, and value for money audits on the projects that delayed these projects. And if funds became short, then it would mean that because of the delay in executing the projects, inflation would have affected the original cost that we had anticipated to complete these projects. Let's see what the next question is. Sorry, I did not trust you before. Now I know you are the best for the job. Frank Apia Kubi. Thank you for your kind words. From Stephen Musa, what will you do differently when Ghanaians finally confirm you come December 17th in relation to uncompleted projects? Because your opponents say you also abandoned J.A. Kufuor's projects too. I think that the optimal way forward would be to take an inventory of all these uncompleted projects, not only in the health sector, but in other sectors, and apply resources to complete them before starting new ones. Indeed, there might be some critical new ones that need to be started, but our focus should be on completing the abandoned projects. And I must say that I don't know what projects are being spoken about, but all the projects we inherited from President Kufuor, we continued. Some we completed, some we didn't complete because of difficulties with raising the resources for them. And I can give you an example. There were the gang of 6 roads that were being financed from the government of Ghana budget. These were huge road projects that remained uncompleted when we came into office. When we came into office, we took these roads on. The Tetekwashi to Legon Road, we completed it. Legon to Adenta Pantan Road, we completed it. We completed the Military Academy Road, that is the Teshi Road. We inherited it from President Kufuor. We completed it. We completed the Achimota Ofankor Road. We completed it. We continued with the Nsawam Suhum Road. Indeed, we finished the bridge, and we finished one carriageway of the road before we left office. It is left to the other carriageway, which I expect that this government should continue. But I noticed that in the last 3.5 years, no work has taken place on that road. We continued with the Sofo line interchange and made it usable. Even though work is not complete, we took it to an advanced stage of completion. And so there are several projects that we inherited from the Kufuor government, which we did not abandon, but we continued and finished, and some we didn't finish. And it's my expectation that a succeeding government would have continued and finished them. you are no longer the president, why do you address the nation with a flag behind you? There's only one president, and that is Nana Addo Dankwa Akufo-Addo. And this is from Kwesi Appiah. Kwesi, thank you very much. I recognize I'm no longer the president, and I don't pretend to be the president. The Republic of Ghana has a president, and that is President Nana Addo Dankwa Akufo-Addo. But there's no legislation that says Ghanaians should not use the national flag. Indeed, we are encouraged to display the national flag as much as we can. And so in private offices, in our homes, if you can put the national flag there, you're encouraged to do that. What makes the difference with the president is that the president has his own standard. And so when you see the president addressing the nation, you see the Ghana flag, and you see the blue presidential standard. That one, nobody in this country is allowed to use that. And that differentiates the president from everybody else. I'm a citizen, you know, I'm not the president, I'm a citizen like anybody else. And I respect the national flag, and I'll promote it whenever I can. From Kofi Wayo Central, I don't know if that's part of your name or it's your location. Mr. President, what is your plan to better equip the health insurance scheme and make it focus on its mandate so that it will not veer off to sponsor MPs for study abroad? Indeed, the health insurance scheme has faced many hazards, and these hazards include venturing into areas that probably are not its core business. Maybe one believes that health insurance, if there are any scholarships, they are better handled by the scholarship secretariat. And so if there are any specialized, you know, professions that the medical field needs, it is better being handled by the scholarship secretariat than the health insurance. But one of the major hazards the health insurance has faced is what we call the capping and realignment policy. This is a policy that was introduced by this government. For a government that had said that the health insurance was in crisis, to come and take almost 900 million Ghana cedis every year out of the National Health Insurance Fund is, I mean, an issue that one cannot understand. The capping and realignment means that government caps all statutory funds at a certain percentage of budget. And so if you exceed that fund, then government takes the extra and puts it back in the consolidated fund. So as a result of that, I understand that there are facilities that have not been paid for 6 months. There are others that have not been paid for as long as 10 months. And I'm even hearing an example of some facilities that have not received refunds for their services for almost 14 months. These are unconfirmed reports, but it's obvious that they are unpaid claims, and therefore these are, you know, stymieing the ability of these facilities to provide service. In the Speak Out tour that I undertook, one of the major complaints was about the service being given to NHIS cards holders. It was said that the only service they get is free cards when they go to the hospitals, and then free consultation. Everything else, from diagnostics to pharmacists and medicines and drugs, are all paid for by the individual. And so we need to look at the health insurance and review it. Before I left office, we had set up a committee that did a review report, and it came up with several suggestions, including looking at primary health care and seeing whether we could hive it off the health insurance and make primary health care free for all Ghanaians. These are all ideas and suggestions that came up. We did not implement them before we left. It is my hope that this government would have seen that report and would look at it and begin to implement it. SNIT rubbished your recent suggestion to pay contributors a token amount for 3 months to enable them buy food during these COVID times. What do you make of that? Yao Ameko. Yao, I was surprised to hear the response of SNIT. Indeed, I've been a member of parliament for 3 terms. I was in parliament for 12 years. And so I know that the National Pensions Act, Act 766, is what governs SNIT in terms of its operations. But as an experienced member of parliament, I know that allowance is made for amendments to acts in order to allow state institutions to do certain things. So when I made the suggestion, I was not suggesting that SNIT should act illegally by paying those monies. My suggestion was that SNIT and government should consider amending the act so that SNIT could make those payments. We've been in Parliament when amendments are brought under certificates of urgency. They are moved in the morning and they are passed by evening. If government has the will and SNIT has the will, then it is possible for this to be done. So my suggestion was not that SNIT should act illegally. My suggestion was that steps should be taken to amend the act so that in these trying times, some part of workers' contributions could be given to them to be able to tide themselves over. And I gave a specific period, for a period of 3 months, until they're able to go back to work and be able to continue their contributions to the Social Security scheme. This is what Social Security is all about. From Nicholas Walter Lutrod: how can we trust you compared to your main competitor, as you always claim you are incompetent and corrupt? Some of us find it difficult now to trust the politician. That is the sorry state our democracy has gotten to. I meet a lot of people who say they are, actually, their confidence in our democracy is broken because of the many promises that are made that are unfulfilled. In terms of competence, I have always said that I leave it to the people of Ghana to decide on what the competence or incompetence of any government is. I did my best, and there were some things that I did very well. There were some things that I could have done much better. But these are all lessons that you learn, by engaging in leadership. And so I've learned my lessons, and I'm sure that if God wills it and I become president again, I would do a better job than I did in my first term. Even though we did many things well, there are other things that we will do better. As for corruption, I believe we all know how difficult a fight it is to deal with corruption. And I believe that we all must be held accountable. I have no qualms about anybody being held accountable in my government. And indeed, after I handed over to the MPP administration, I said that all those who served in my government, including myself, must be ready to face the hot scrutiny of accountability. And I'm always ready to do that. If there are any issues to do with corruption, I believe that this government should go ahead and investigate and prosecute. And that is what serving in public offices, you must be ready to answer to the people at any time. And from Rex Omar: we can even make Ghana the center for healthcare in Africa to promote health tourism. Indeed, this was the intention of setting up the University of Ghana Medical Center. It was supposed to improve the healthcare of Ghanaians, but at the same time, it was meant to become a center of excellence in Africa so that people who needed specialized health services could come from our neighboring countries and from other parts of Africa to come and have, medical treatment here. And so that was one of the main reasons for setting up that center. It was also meant to stop the practice where top government of Ghana officials had to go outside the country in order to receive medical treatment. Those medical services will be available locally. And so it will not be necessary for the president or for ministers or for other high public officials to go abroad for medical treatment. And so, yes, I agree with you, my brother. It is possible for us to make Ghana a center of medical tourism and let, other people come from different locations to come and seek treatment here. There are examples of it. In Egypt, there are specialized hospitals where people go for treatment. If you go to South Africa, a lot of our people go to South Africa for medical treatment. And there are several other areas where such services are offered. And this is from Ni Pakpo Samoa Ado. Will you consider a corporate tax to help fund the NHIA, Your Excellency? I believe that it will be difficult to increase corporate taxes, especially when you want to stimulate the economy. Our current corporate tax rate is at 25%. If you want investors, manufacturers, and business people to stimulate jobs, it will be very difficult to pile on another corporate tax. But there are other ways in which we can increase financing to the National Health Scheme, Health Insurance Scheme. And we're going to put a whole list of those alternative financing on the table. I believe that we can make our National Health Insurance much more robust and more sustainable, because it is one of the important lifelines that our people have in terms of having access to good health care. Let's see. It says, from Abeku Hayford, Your Excellency, how will you strengthen the teaching hospitals technologically to support medical and allied health students across the nation? We have done this before. We had a major re-equipping of teaching and regional hospitals. This project was implemented by my predecessor of blessed memory, Professor John Evans Atta-Mills, where diagnostic equipment were procured to the tune of in excess of $200 million. And these equipment were installed in various tertiary hospitals across the tertiary and quaternary hospitals across the country. There were CT scans, there were X-rays, there were MRIs, and so many other such equipment. And some of these equipment are still what we have in use currently. It is important that government continues to make sure that our hospitals have the technology to continue to provide good service to our people. And so government will continue to do this. But we need to put in a system that makes it possible for the equipment to be used sustainably. There are many cases where the equipment breaks down and the hospitals are not able to maintain them. And so we must create a system where we're able probably to allow private sector participation in diagnostic services in our hospitals, so that we can make sure that those equipment are always available for use when the public needs them. What are your plans for posting healthcare professionals, nurses, and others? Like I said, if you look at our ratio of healthcare professionals to our population, we are far behind in terms of doctor-to-patient ratio, nurse-to-patient ratio. Indeed, this informed some of the investments that we're making in the healthcare area in order to expand facilities to be able to bring in more nurses and doctors. Indeed, those hospitals that I just talked about, if they had all been completed, we would have added about 6,000 more beds to the hospital beds that we had at the time. And if you do an average of about 3 nurses to 1 bed, then you had 6,000 times the number of hospital beds that would have been provided. And so there's space for us to employ more nurses, but it also means that we must expand the facilities so that we have the suitable facilities where they can be employed to work. As I said, we have done a gap in terms of human resource. We've done an analysis of our human resource gap, and we believe that there's space to accommodate more health workers in our public health institutions. It will also help to expand the mission hospitals and the other faith-based organization facilities. It will also allow them to employ more healthcare personnel in their hospitals and other facilities. Let's see, Abdul Tamani, what would you have done differently if you were president of Ghana now? Would you have lifted the lockdown now or imposed total lockdown or curfew? It depends on the science, and that's why I said I don't know the science and the advice that was available to the president. I don't have that same advice. And so I wouldn't understand the reason for his the decision he took. But experts I've talked to And the Ghana Medical Association and other such institutions were quite puzzled that he raised the lockdown at a time that the numbers were increasing steeply. I mentioned earlier, even before the lockdown was lifted, that one of the things we needed to do was to expand testing as quickly as possible, increase our testing capacity so that you know the trajectory the disease is taking. And based on that trajectory, you can take a decision whether to raise the lockdown or to maintain it. But be that as it may, the president has lifted it. And after it was lifted, we're seeing cases in all the regions. And so it means that we must aggressively expand testing, and we must also expand capacity for contact tracing in order that we're able to identify who has been infected and who they have been in touch with so that we bring them into isolation. Unfortunately, we do not have enough isolation centers because several of these facilities were abandoned. We would have had more facilities where we could bring people into isolation, test them, and observe them. If they don't show symptoms of the disease, then you can discharge them back. But unfortunately, we are constrained when it comes to facilities to even isolate these persons who have tested positive for the virus. From Adam Kojo Matthias, hello, Mr. John Mahama. What will you have done differently in terms of stimulus package for the vulnerable people if you were president today? If you do a lockdown, one of the things you have to have right is your humanitarian intervention, because you are basically asking people to stay at home and not go out and engage in economic activity in order that they can earn an income to feed themselves. Unfortunately, government's humanitarian intervention was a disaster. The whole system of food distribution was so poorly organized, and indeed, that is one of the reasons I believe that forced the president to lift the lockdown. Because if it had continued, people would have faced the option between starving or coming out and taking their chance with the virus. And I believe that, we should have organized this better. I made a point. I said, we have a system where we're able to deliver electricity and water bills to every corner of this country to collect bills for government. Why could we not have the same system to deliver food to the doorsteps of the people? And so these are lessons that we must learn. And I believe that if I was president, I probably would have planned this better and would have executed it in a much better way. Moraudu, the MPP has not taken kindly to your statement that the Ghanaian economy is in ICU. They claim that you should know better than it is. Not only the Ghanaian economy that has taken a hit as a result of the COVID-19 pandemic, and it is the world over. Well, we have other African countries to learn from. We said our economy was so robust and it was the fastest growing in Africa and all that. Ask yourself, how many countries have run quickly to the IMF to go and look for relief? We have next door our neighbors, Togo, Cote d'Ivoire, Rwanda, and so many other African countries. If we had one of the best economies, why within only 3 weeks, our economy was almost on the verge of going on its knees, and we had eaten kenkey and celebrated leaving the IMF. We quickly ran back to the IMF. I don't know whether we'll eat kenkey and celebrate going back to the IMF to go and seek relief. It is the truth. Even before COVID, there were problems with this economy, and I kept pointing out that the Minister of Finance was engaged in creative accounting. He had put a lot of debts and arrears under the line and was not adding them to the budget accounting. I had pointed this out several times. And if you go, if your mother dies and you pretend that she's not dead, when the body starts smelling, everybody will find it. And so when COVID came, the speed with which our economy already, was in crisis was alarming. Indeed, I said the other time that one top government official said that with the kind of foreign reserves we have, our economy can survive for 3 months without any, external intervention if we are faced with a disaster. We were faced with a disaster for only 3 weeks, and already we were seeking external intervention to keep the economy afloat. Haj Kupsin, when you become president again, will you consider the Yendi Water Project as your priority and the Yendi Hospital as a referral center to serve the Eastern Corridor? Absolutely. Indeed, the Yendi Hospital is one of the projects we were working on before we left office. Unfortunately, we're not able to tie in the financing before we left office, but my understanding is that the current government is working on that financing to expand the Yendi Hospital and modernize it as a referral hospital. Also, the Yendi water system. The Yendi water system and the Damango water system were both water projects that we were working on and handed over to this government. And I hope that it is being worked on and that soon we shall see the start of these two projects. Emmanuel Metal Labi. Your Excellency, please, what are your plans to develop and equip the pharmaceutical industries so that we can produce drugs and vaccines locally without depending largely on imports? Indeed, I have the track record of supporting the pharmaceutical industry. Indeed, the largest assistance to that sector was made under my government. We, under the EXIM facility, provided 50 million Ghana cedis to Ghanaian-owned pharmaceutical companies to expand their production lines for two purposes. One, to increase the employment of Ghanaians, and then two, to expand their products and enable them begin exports into our neighboring West African countries. And this happened under our regime. Tobinco, NS Chemist, Dan Adams, and several other pharmaceutical companies received this assistance. And during our time, I am aware that they started exports to Liberia, to Sierra Leone, to Burkina Faso, and other neighboring countries. From Ni Ayite, in your last statement, you talked about herd immunity. What do you mean by that? Herd immunity is when you're faced with a virus. One strategy is to let the virus run through the population. And as it runs through the population, when people get infected or they are exposed to the virus, they produce what is called an antibody. And antibodies are the soldiers that fight off disease. And so once they get the antibody, they're able to fight off they're able to fight off that particular disease. So herd immunity means that you let the virus run through the population, and then the people gain immunity to it. So as the number of people who have been infected expands, the disease has no more space to expand within the population. And so it dies off naturally. And that is herd immunity. It means that you don't do anything about it. You just let it run through the population and let people gain immunity to it. The danger is that with COVID, a certain percentage of that population will die. And in our case, it's estimated at about 1%. For instance, when the head of the COVID response said their model shows that about 3 million people will get infected. And out of the 3 million people, about 150,000 will require critical care. And out of the 150,000, about 5% or so will die. And so he said about 15,000 people will die. The issue is that his model might be wrong, and that is not only 3 million people, that far more people than 3 million could be infected. And if far more people than 3 million are infected, then it means that the number of people who will die will not be 15,000, but it will be much greater than 15,000. So you don't know who would live or die. And that is why the risk of using the herd immunity strategy is very dangerous. There are other countries using it, like Sweden, I think. And even though there are deaths taking place there, they are not enforcing stay at home and lockdown and so on and so forth. Let's see, from Agbesi Pakpa. Dear JM, what austerity measures would be adopted to revamp and sustain the economy to fuel the great visionary policies you seek to implement? Post-COVID, our economy is going to be in a very weakened state. Indeed, this year, growth is estimated to be about 1.5%. It's going to be one of the lowest growths we have ever experienced since the Fourth Republic. And so revenue is down because the revenues are not coming in. Aside from that, our expenditures have gone through the roof. Our debt is at about 70% of GDP. And so we're going to face very difficult parameters. And so we need to take critical action to bring the economy quickly back on track. But we must do that side by side with making sure that, one, we are stimulating business in order that they can create more employment and they can be the driver for bringing the economy back on track. One of the things that I believe we must do, and that I intend to do, is to encourage and promote Ghanaian business. Because over the years, the share of Ghanaian business in our GDP has consistently fallen. In the 70s, the share of Ghanaian business in our GDP was 72%. Today, I believe, is somewhere around 40%. And so it means that a greater share of our GDP is in the hands of foreigners than Ghanaians. And so we're going to prioritize Ghanaian business and stimulate Ghanaian business to be able to grow and expand into other areas out of commerce. A lot of our people are into commerce. We need to go into manufacturing. We need to go into agribusiness. And we're going to use the strength of the government's budgetary purchasing power to make sure that we're able to stimulate these industries and get Ghanaians to go into these areas. To all Ghanaian, okay. When will you name your running mate? From Francis Xavier. Francis Xavier, we are on track. We're not behind time. And the party is working assiduously. I have a firm idea who I want my running mate to be. And we will name him at the appropriate time. We have timelines that we are working on. We have to put up our national campaign team. We have to name and outdoor our running mate. We have to publish and inaugurate our manifesto. These are all timelines that the party is working on. Currently, we're getting ready to do the training of trainers for our party agents. And so we're not late at all. The deadline for naming our running mate is when the Electoral Commission opens nominations sometime in September. And so we do have enough time. But my brother, in the midst of COVID, you know, what is the use of naming a running mate? You can't even outdoor him. You know, the president is encouraging all of us to stay at home. And that's not the most opportune time to come out and name your running mate. And so we are on track. We have the timeline. I have a fair idea who I want to be my running mate. And after I have done consultation at the appropriate time with the National Executive Committee and the Council of Elders, we will bring out a person who will be worthy of being the NDC's running mate and who will make a significant contribution to the progress and prosperity of this country, I can assure you. It is time to go. We started at 8:15 and it is approaching 9:15. My brothers and sisters, it is the primary responsibility of every government to secure the safety and health of every Ghanaian. And this should never become the subject of ad hoc policy making or reactive governance. Health is one of those sectors where outcomes are dependent on investments made over time. And wholesome experimentation and knee-jerk responses cannot suffice in this endeavor. The lessons learned from this COVID-19 episode must occasion a drastic rethink to our approach to health delivery in our country. Going forward, premium must not be placed on shallow populism or empty sloganeering over substantive investment, careful planning, and policy making. The sort of political point scoring and unnecessary pettiness that led to the abandonment of much needed health projects must never ever recur. Political vendetta should not supplant or derail well-reasoned interventions in nation building. I therefore wish to re-emphasize before you, the people of this country, my unambiguous commitment to completing all ongoing projects I meet when, God willing, I become your humble servant once again in January 2021. It is my prayer that the COVID-19 pandemic passes quickly and does not wreak any more havoc than it has done currently. My prayers remain with those who have been infected and are receiving treatments. My prayer and condolences are with the families that have lost loved ones. May the good Lord strengthen and bless the tireless efforts of our frontline health workers who continue to labor day and night to defeat this pandemic. And let me reiterate again, to those who have lost their loved ones among the 17 who have unfortunately passed on due to this pandemic, I express my heartfelt condolences and reiterate that their memories will be honored even more diligently as we work in future to prevent such a catastrophe.
Welcome to Loud Silence Radio and TV Network. My name is Kevin Akorbedu Taylor. This is the extended version of With All Due Respect. We are headed for ourselves. The ex-president John Dramani Mahama today made some statements. In fact, went deeper than we thought he was going to go. He verified some issues. He corrected some issues out there. He also told us about the plans of the NDC when they take over, if they are able to take over come 2020. So, it's an interesting thing to discuss today. But hey, just a reminder, he talked about a few things, and maybe we can just run through them quickly. We are going to take your views. We are actually going to take the views of our listeners, the family, what you made out of Mahama's statement, talking about infrastructure, talking about the plans for NHIS, talking about the statements he made about SNIT, talking about how the plans they have actually for the frontliners, the nurses, because in his statement he made a statement like some of the hospitals were put together so that like about 86,000 health personnel will get access to these health facilities. He made it, he talked about the Ghana Medical Association and how the government, the NDC government, had plans of, in fact, absorbing about 86,000 health personnel. That's why they were putting up a lot of hospitals and multi-million and ultra-modern hospitals. He also talked about a few things. In fact, let me see. He made Ghanaians understand that there was so much pressure in our facilities in Ghana, especially the health sector. So they decided, the NDC government decided to build these ultra-modern hospitals at the Bank of Ghana, Legon Hospital, all the regional hospitals and the CHIP compounds. There was a specific reason why the NDC took that action. It was because they were seeing ahead and they realized that the pressure on the facilities, if they had not taken action, it was going to be a problem in the future. That's why now we are seeing things like that, whereby some hospitals are not fully equipped to even handle this COVID-19 issues. He also talked about other infrastructure that they have not actually talked about. He talked about roads, he talked about education, but he actually said that they were going to go into that. Today we are going to stick with the education he talked about. He actually made a revelation here, which I think later we need to be asking questions, that the Legon Hospital, which has about 650 beds, only one part of the hospital has been open. This government came into power in 2016. They said this hospital was going to be put into use. There was one gentleman who actually demonstrated alone to tell the president that the hospital has to be open. Today, the ex-president told Ghanaians that he knows for a fact that only one part of the Legon Medical Center has been opened. And this is quite worrying because I think the hospital, if we think the hospital is ready, why don't we put it to use? Because from the pictures we have seen, that hospital is better to be an isolation center, even the parts that are not ready to be an isolation center, because I don't think you need to go recreate any. But hey, I'm trying to break it down for you to understand. He said before the Legon Hospital was built, they made preparation to send some medical personnel to Israel to learn about advanced technologies and how to handle the medical center. So the Ghana government actually sent Ghanaian doctors and nurses and some practitioners to Israel to specifically learn about some specific things and specific equipment that they will be handling at the Legon Medical Center, because they wanted Legon Medical Center to be the center of attraction when it comes to health in West Africa and the sub-Saharan Africa, like where we have what we have in Egypt and other places. So there was a reason, there was a vision there that this hospital will be basically, literally, to be a tourist hospital whereby people will travel from other countries to come there and receive treatment. That's why the government of Ghana spent money on these health professionals to go to Israel and learn. But as he speaks, these are the words of John Mahama. These doctors who went for the training have been dispersed around the nation. They don't know where they are because now the hospital has not been opened. So all the skill and the knowledge they went to Israel to acquire has not been put to use. He also talked about how some companies who were supposed to complete these hospitals that he was talking about that were left almost done, were not able to finish, was because he gave several reasons. One, the government deliberately delayed by telling Ghanaians that they were auditing the companies that were actually constructing these hospitals. They were actually analyzing corrupt activities if any money was taken out. So all the years the government was wasting in doing this, inflation and all that came in and prices of everything changed. That's why the government is not able to handle the construction of all these hospitals, because if the price were 2 million, now it's 6 million. It means your delayance and your negligence has put the government in this position. So he believes that it was a deliberate delay of this government that has caused the halt or the delay in construction of all the various hospitals he talked about. He actually made a very emphatic statement when he was talking about it. He said, we should avoid knee-jerk promises. And I think that statement was directly to the president, Nana Addo Dankwa Akufo-Addo, because he believes that the president said a lot of things, especially in the health sector. He told the nurses, the young doctors, that when he comes into office, everything that was there for him to continue, he was going to complete it. He gave series of examples. So in that context, he said we should not, or we should avoid knee-jerk promises. Now, he also talked about the National Disease Control Center, and I've heard him say this several times in his speeches, that they have plans. If God willing, they are given mandate again to come rule Ghana. As a leader, he will make sure a National Disease Center like what we have today, Noguchi, KCCR, is put together across the nation so that when a pandemic like this hits again, we will be able to handle it swiftly. Than today, the pressure is only on Noguchi and also KCCR. So there was a vision that they're going to open up more disease control or disease response, national disease centers across the nation. He also talked about the National Disease Response Plan. It was the same plan that they actually adopted when Ebola was around us. You know, our neighboring countries recorded Ebola, but it was that same response. And he was thinking of, in his second coming, you're going to expand that, and that it will be a robust, stronger response to all borders to make sure our country is secured when it comes to issues with health. He also talked about how the frontline workers, nurses, young teachers, young nurses, young doctors who are graduating, coming up, how they deserve better services, and how he expects the government to help them more than what they are doing now, because majority of these nurses, young nurses, teachers in various hospitals, CHIP compounds, clinics are crying out that the government has neglected them when it comes to supplying them with basic PPEs. And we've seen it all over the country. As we speak today, Kolebu Teaching Hospital has shut down about 3 of its centers because somebody tested positive here. I think if the hospital was equipped enough, the personnel were equipped enough, the hospital wouldn't shut down those centers. They would at least maintain it and still make sure the hospital is operational, those centers that have been shut down. So these were the kind of things he was trying to let Ghanaians understand, that there's much to be done. But he was emphatic about some of the points he made, and he said that the deliberate neglection by this government to continue the projects that he left behind is the problem, is the reason why we are having this problem facing this pandemic. Because if the government had decided to finish all these projects, the government could have still gone ahead and do their checks, do their audits. People who were found to be against the law would have been brought to book the same time, saving life and making sure the system works. But what the government did was, even though those companies that were given the contracts to build these hospitals across the nation, the government came back to go against the word of the administration, the past administration. Now the government started taxing them at the port, whereby in most of the contracts they were told that because of health issues and all that, and because of what they are doing and we needed it, most of the items were not supposed to be taxed. Most of the taxes were supposed to be waived because we wanted the health facilities done. But this government came in and started taxing these companies, making it difficult for them to even bring in machines to start working. And also the government telling these companies that, I'm talking about the construction companies, that they were auditing them and that everything should be halted. So he indirectly blamed the president for taking such initiative, and he believes, in his words, that the president, Nana Addo Dankwa Akufo-Addo, under his management, they have made bigger, they have caused this problem. When I say the problem, we are not able to hold, sustain, to fight this COVID-19 in various hospitals in the country. There are a few things he talked about. I'm trying to summarize things, make it easy for everybody to understand. Some people missed their speech. He was asked a lot of questions. If I remember some of them, I'm going to tell you. But in general, most people listen to the ex-president. As you always, if the president also comes out to give a speech, we are going to play it live here on Loud Silence Radio and TV network. Today, it was John Dramani Mahama speaking to Ghanaians, literally having a press conference, because the questions were coming live. He was answering. That's why I keep asking that, where is the president of the Republic of Ghana? This is the time we need a president to answer random questions from journalists. We have 2,074 cases in Ghana today. We don't know where the president is. The only time we see the president is when he's behind the camera. I don't have a problem with the president, but as a leader, you need to be bold enough to stand in front of us and speak over your head to know that you are on top of issues. That is my problem. If the president is not on top of issues, that is why you have people coming and speaking in other languages, which is going to cause a lot of confusion in the system. If you're still listening to me, we are going to be taking your calls. If my producer is listening to me today, we're going to yes, a lot of things happening on Facebook. Let me see if I can read a few messages before we move on with and I'll read a few messages too on YouTube. We all heard it for ourselves. I'm going to give you the opportunity to also make your honest and have your honest opinion on what the ex-president John Dramani Mahama talked about this evening, specifically about the health sector. If you think there were some things that he said that it was a lie, bring your facts, tell us, let us also discuss it and break it down for Ghanaians to understand. My fellow Ghanaians, this is the time we have to change the way politics is done in Ghana. It's a fact-checking season. If somebody says something is not true, let us know. If somebody is also trying to throw dust into the eyes of people, let us know. My fellow Ghanaians, we are here to think about Ghana. We are here to elect a leader who will think about us. We are here to think first before we go to the ballot. This is the time. We have the opportunity. Today, through technology, we can talk to our leaders through Facebook, ask them questions for them to answer. My fellow Ghanaians, this is the time we have to come together and start thinking about Ghana. So, quickly, let me see what's on Facebook. Akoto says, in fact, JM has taken leadership and governance to a different level. Bravo, JM. That is coming from Akoto Osei. Susan Jean Candy says, this 7 December 2020, GM all the way. Okay, thank you. That's your opinion. Ernest Ofe says, there no, Paul Adomotre is on Metro TV trying to find fault on what GM said. Okay, Josephine Bafo says, press conference said he can't, I don't know, he needs slabs as well. Okay, Michael Frimpong says he interacted with Ghanaians. Excellent. Mahama, 2 questions. Thank you very much, sir. Yasino Gi says, Nanado Apu, where even the questions will be selective. That is his opinion. Kojo Entry says, no wonder they are crying. He's acting as the president. Can't the president do the simple thing by interacting with the media? That is a good question. Mohammed Rashid says, what will benefit Ghana? What will benefit Ghana to pay taxes, but hotel bills by someone will get tax waivers? Okay. Medman says, Mr. Kevin, with all due respect, this is the president we need, not the Kulu. All right. Susan Jane says, we only see the main president 10 p.m. when I'm far asleep. That's the opinion of the beautiful lady there. Please, let's pray for Nanado. Angel Michael says, I learned this issue at the clinic is getting worse. He keeps saying GM has finished him. Adam Ama Obusa says, GM is the best. Ghana needs him. Nana and his fat government must go. They are wasting our taxpayers and money. Anthony TK Nelson says Paul Adomotre has set up his garbage worms, virus, pathogen, table selling hot worms, poison, and silly call in. Okay, we are tackling the issues. Hey, irrespective of who is in power, we need to talk to the issues. Hey, if GM lied, let us know. If he said the right thing, let us know. We will read it. We will let the Ghanaian understand. At the end of the day, we need to get to a point whereby we make decisions. We listen to these politicians and sit back and analyze their comments and look into the future and see if it's going to benefit us or not. This is the time we have to start doing that. Don't rely on a journalist to come and throw anything to you. Sit back, listen to them, and then do your own analysis and do your own checks and make your decision at the end of the day. Nobody should decide for you who to vote for come 2020. You have the right to decide for yourself. Fellow Ghanaians, let's see what's happening here on YouTube. Okay, on YouTube, yes, a few messages here, then we can go straight forward and do some. On YouTube, let me read some few messages here. Kaman Gabriel Avles says the COVID has exposed the weakness of the current government health sector. All right, that's his opinion. Isabella Roslyn Schroeder says a very humble man. Thank you very much, Isabella, for your text. Zaria Abdullah says, GM, 3-month-old bridge has been washed away during a small rain. What will do to the contractor and the person who contracted him? I did not mention name. No, okay, that's here. I think we have an idea of his question. Jane Phillips says, Sandra, please do where you are. Make you journey back for the vote. Okay. D Smash says, close the chat button on your smartphone and hit the like button. Okay, thank you very much, D Smash. You are still on YouTube. Jennifer Baden said, I like the response he gave about the abandoned Kofor's projects. Okay. Jim Maman says, NPP always claim to have back their country. NPP always claim to take back their country. Is Baumia an African Akan now? Gonja land is closer to the Akan kingdom and Mamprusi land. Or is it a remark the party VPs don't take notice? All right. Deborah Mama says, yes, he should. So we hear him out too, because GM has answered all his questions. Well, as an intelligent man, he is. Good evening, Sir Kevin. Thank you very much. I'm sorry I couldn't piece your text together well, but I know we all understand your message. Samuel Enum Ajete, it's okay. This match is back again. Let's see who is here. Hamisu Ibrahim says, I'm watching you live from Malta. Greetings to all Akim Achasi people. Okay. Della Duke says, Kevin, don't bother asking the president to come answer questions. Those selected journalists who will come ask questions are all staged, managed. Lots and lots of messages on YouTube. Let me take time and read a few of them. Come back to Facebook, and then maybe we will open the phone lines. Yes, in fact, we will open the phone lines and hear your views on ex-president John Dramani Mahama's speech. Richard Kofi Ago says, what the ex-president did is a clear exhibition of true leadership. The man is on top of the game. JDM has taken leadership and governance to the next level. Thank you very much, Richard Kofi Ago. What the ex-president did is a clear exhibition. Okay, I think I've read that. Ike Laser says Nana is becoming more and more useless when Mahama speak each time. Mina says, Kevin, keep doing your work. You are one of the few. Thank you very much. Jomens TV, I'm watching live from Austria. Thank you very much, Jomens. So, my fellow Ghanaians, the family, this is it. This is it. We all listened to ex-President John Dramani Mahama and his speech. Angela on Facebook says, GM's speech tonight has finished Nanado 4 years of being president. The Babs GH, Ekufuado, the hold fake certificate. His head is totally empty. That's his opinion. Etonam Kofi Ziga says, Kevin, please talk for us one day. Why? Almost 3 years now, there no Premier League, no football. For instance, some people are thinking about soccer bet too. Share in your brain rough. Abdul Mumin Al Hassan says, okay, Brooklyn Frank Khalifa, GM should really check on his staff and follow working members. Okay, Pilado watched JDM with fake accounts. So, as you heard for yourself, the president spoke, the ex-president spoke. In fact, I have to be very cautious of my words. We can call him the president, the ex-president. Hey, it doesn't matter. At the end of the day, we need a leader who can help solve our problems. He actually made an emphatic statement, and he said the NDC comes with clear plan. The NDC comes with clear plan. Now, let's do this. Producer, can we take calls? If my producer is listening to me, if he gives me the green light, I'm going to take calls. Yeah, so yeah, before we pick the calls, let's actually take some few minutes and talk about something quickly. In fact, the numbers are now 2,074. The numbers of COVID-19, yes, people who have been infected with this virus in Ghana, the total number is 2,074. Those are the confirmed cases. We have 212 recoveries. And then we have 17 people who have died from this virus. We have 2,074, 212 recoveries, 17 deaths. You remember, after a president left the partial lockdown, it's been 1 week, and we've recorded over whatever number, over 500 cases. So we have to understand that the decision by the president to lift the partial lockdown was a very, very bad one. Let's be honest. If anybody comes to you or stands on TV or comes to Ghanaians to tell them that, you know what, we are making progress, the numbers are going up, and the horizontal and the vertical, and then more people, it's a lie. The numbers are getting scarier. The frontline workers, the nurses, the doctors, they know that it is serious. I told you a week or 2 or 3 ago that the numbers were more than 2,000. I even said it was 1,002 when I got my facts from my source at Nuguchi. It has passed 2,000. Now, fellow Ghanaians, this is not a time for us to be playing politics with this. If we sit back and act like there's nothing wrong, you and I, we are going to die. Our relatives are the ones going to die. You, the poor Ghanaian, you are the one going to die. In the middle of this, we have recorded 2,074. There are lots and lots of people we can't trace who are already in the system. Today, I read on different platforms how some taxi drivers, how some school kids, how people have the virus. It is in the system. The government is suppressing and massaging the numbers. It is getting scarier. This is not politics. It is about saying the truth and being honest with each other. The government of the day is lying. And let's be honest with each other. The president has to come out and face the press, face Ghanaians. If he doesn't even want to meet the press, he should just come and do this same thing. Facebook Live. We will ask him the questions for him to answer. Let his people, because we don't know what is happening. The president comes to tell us that we need experts to speak on this COVID-19 issue, and the next day you see the information minister and the agric minister, they are the professionals speaking on this COVID-19 issue. They are not surgeons, they are not scientists, but at the end of the day, the president says we should wait for professionals. We don't hear any professional. The first gentleman of the land who is briefed every single morning by the national security as the commander-in-chief of the Ghana National Armed Forces, of the Ghana Armed Forces, he has first-hand knowledge about this. He knows how many people have been infected. He knows how many people will die. He knows the numbers and the facts. So why is the president not meeting us in person to speak to us as somebody who has been briefed, who has been given the first-hand information about this COVID-19? And we are doing politics with it. Every time we talk about these people making bad decisions for us as a people, some people bring in politics. Hey, Mahama sent you, NDC sent you. We are going to die. And I've been saying it. We are going to die because the numbers are crazy. They have passed 3,000. We have passed 3,000. But this president and this government, they don't want to tell Ghanaians because the only motive is that we should try and minimize things so that the NPP can go for Congress, the EC can do registration, the NIA can go ahead. The president should understand that we are talking about human lives here. That is what the president must understand. He should avail himself. He should come out for us to ask him questions. Prepared speeches written by some young man who is being paid to write speeches and go and pick people's speeches and put it. Those are not the things we want. We want the president to show up in front of the press and then speak off his head to make Ghanaians have some confidence. Why should Ghanaians now have confidence in an opposition leader than the president of the Republic of Ghana? The statement I saw Muhammad made, the speech I heard Muhammad made, to be very honest, I was expecting the president of the Republic of Ghana to make such a statement. Have you realized one thing? The president has even never wished or consoled the people who have lost relatives in this COVID-19 pandemic. He has never done that in his speeches. That is the problem we have today. And then when you try to do this, you get some people thinking that you hate the president. But we are all going to die if we allow the president to take bad decisions every single day. You see, let's be reasonable here, my fellow Ghanaians. Where is our leader? Who is giving us the right figures? Who is telling us the truth? The information minister is lying. The moment the president lifted this partial lockdown, the numbers had doubled. Now we have about 500 to 600 people who have, in the space of 1 week, have had this virus. Meaning the virus is in the system. It is crazier. That is the problem I have with this president. And till date, since this started, the president has not met the press. The president has not met Ghanaians in person to speak to Ghanaians, take questions from Ghanaians and answer off his head for us to have some belief that, you know what, we have a leader who is on top of issues. No matter the angle you bring the questions, he knows the issues and that we should be rest assured that this man will lead us. We are not seeing that. We are not seeing the leadership. We are not seeing anything. Every day, some young men will come and stand there and come and take donations, and Kojo Upon Kruma will come and lie, and you go away. And everything is bizarre. There's no government. There's no procedure. There's no process. There's no strategy. There's no strategy for Ghanaians today. And let me tell you, my fellow Ghanaians, you see, you can defend the government and defend the government. I understand. It is what you like. It is what you believe in. But let me tell you, if you don't start talking to protect or defend yourself, you will die and that government will be there. There's 19 people who died. The 19 people who have died, you are not better than them. And I swear to God, some of them might be more MPP than you. Some of them might be more NDC than you. But they have died. Because the government we have today has failed to put together. You see, Mahama made a statement and said that what caused the president to lift the ban was because the government could not sustain the economy that we have been bragging about for years. So the government was forced to just lift the ban because the government cannot feed the people. The government cannot keep the people indoors because it was going to get to a point people were going to boil and they will step out and have confrontations with the police. Why is this so? It is because we have been lied from day one that we have a robust economy. Till date, Upon Nkrumah has the guts. He does not respect us to stand in front of us and say that upon all the aid we went for, upon all the lies we all know today, upon all the economic lies, the manipulation of numbers. World Bank advised us. IMF wrote a letter and said, the way you people are manipulating numbers, your economic numbers, it is not good. Now, pandemic hit, and then we are flat after 2 weeks or 3 weeks. That is the problem. The government lies too much. The government thinks that we are too foolish. The government knows that they can lie their way through, and then they will survive because we have become too tribalistic. We have become idiots. We have become people who cannot think for ourselves and know the right thing for us. So they know our weaknesses and they have capitalized on it to survive. Why should a Ghanaian come out and say the president should not come out and speak? Why at this point, who in their right senses will say that the commander-in-chief of Ghana Armed Forces, the man who is our leader, he should not come out and meet the press? We have 2,074 cases. It is no joke. And people are going to die. Lots and lots of people will die. And when we sit in our stupidity and be like we are MPP, we are NDC, we are PP, I saw some boy, Atik Mohammed, that Fulani boy. He is defending the EC for the EC to go ahead and do registration. Such a dirty soul, Atik Mohammed. He has not built anything in his life. Such a dirty soul. He is defending the EC to go out there and do registration. Such a dirty soul whose soul cannot even replace a lizard. That is what politics has done to us. Atik Mohammed now is the voice of the EC. We are trying to prevent such a catastrophe. Then such a dirty soul like Atik Mohammed walking around Ghana and telling Ghanaians that it is right for the EC to go out there and register. Such a dirty soul. You see, it hurts because this gentleman, Atik Mohammed, he does not even understand what he's speaking about. He does not. 9 people have died. 2,074 or 72 people have the virus. America is on its knees. And such a riffraff like that, because of politics, we have given people like that, we have bought them cars, we are fueling them to come and exhibit their stupidity because I belong to a political party. But a dirty soul like Atik Mohammed will stand in front of Ghanaians and say it is good for the EC to go out there and register in these moments. You see, that is my problem with Ghanaians. We need a president. Where is the leader? The numbers are getting scarier and scarier every single day. The prayers are not working. The fasting is not working. Duncan Williams, it is about time you started calling the president on phone to say, Mr. President, common sense. Apply common sense. The 2 a.m. prayers and sweating and your towel on your neck, and then it is not changing anything. This is not a time for prayer. Pray in your room quietly. We don't need you on Facebook. If you want to help Ghana, Duncan Williams and the rest of the clergy, call the president on phone and say, Mr. President, people are dying. Apply common sense. This is not the time. Now we don't have any man, any Enyansafo in Ghana. No Enyansafo again. Right now, go and see, maybe on Good Evening Ghana, they are there. You see, cutting into pieces what John Mahama said about his running mate, cutting into pieces what John Mahama said about, but the evidence are there for us to check. They are sitting there because why? They have to please the president. They have to please Gabriel Chirdako. They have to please Bedieto. They have to please Bumpty. They have to please a whole lot of people to survive as journalists. That is what hurts me as a people, because when we follow people like these, people who cannot be trusted by their own mates, people who steal exams results, examination questions, people who are liars, this is where we get to. Because you see, this is the time. You see, Ghanaians, don't let these people fool you. These people wearing suits and bow tie, they don't have any sense. You have sense past these people. Apply your common sense. What exactly are we doing? We have no plan for this COVID-19. The government the government today in Ghana, this MPP government, this Nanado government, if you ask them what is their clear plan of tackling this COVID-19, they can't give you even one. The only thing they'll tell you is it is mandatory, wear mask, make sure that social distancing. They can't give you clear-cut policies and plan put together to say this is where we are going. They don't have. If you ask the president, if you meet these people on TV, ask them, what is the government's clear plan to fight this COVID-19. There's no plan. Tomorrow left, the next day close, the third day they don't know what they're doing, because you see this government was built out of propaganda. We have the men, or it was a lie. There is no clear plan for this government to tackle this COVID-19. And if we don't start being smart and speaking out and fighting for ourselves, we will all die. These people don't care. The president, he is my problem, because he has shown on several occasions that he does not respect Ghanaians. As we speak, their motivation, what is, you see, as we speak now, 19 people have died. A whole MP is going around radio stations talking about women's panties, what a pastor did, who a pastor slept with. 19 people have died. 2,074 or 72 people have the virus. And we don't see anything wrong with this. That is the problem. The government of the day, this MPP government, has no plan. It has no clear-cut plan. If you ask them today, give us 4 clear-cut plans that we may use 2 today and put the 3 behind us and use as backup in case this thing escalates, they can't tell you. The only thing they will tell you is you have been paid by Mahama. Mahama will not be president again. You are a fool. You are taking money from. That is the answer. They can't give you. They should give you 5 solid plans. That these are the clear-cut plans. We have 2. This is facing this COVID-19. If it escalates, we have this 3 as backup. They can't, because they don't have the knowledge. They don't know how to govern. I say, when you meet them, ask them, what's the government's 5 clear plan policies to fight this COVID-19? The first thing, wear face mask, nose mask. The second thing, make sure that you observe social distancing. The third thing, use sanitizer in your. They can't do anything apart from that. All the so-called plans they put together, you see the way they all fizzled out within 72 hours, because they are not thought through plans. These guys are not visionaries. They don't think about what is going to happen today or tomorrow or the next. They only think about their situation, what they have now. That's all. That's why this pandemic hit, the whole economy came on its knees. And when we start to have these conversations, some Ghanaians think that we hate somebody. We don't hate anybody. Ghanaians have died, oh, my fellow Ghanaian, and you can also die. You are not better than them. Oh. So when you see an ignorant fool like Atik Mohammed pushing and defending EC to go out there and start registering people, NIA to go out, somebody like that, you don't even spare him, because he's somebody. His actions can kill hundreds of people, and such a dirty soul leading an idea like that. That is where we are. There's no clear-cut plan, clear-cut policy. There's nothing like that. Anytime they come to have a press conference, the information minister, the only thing he will say is, oh, this company came to donate to the government. Okay, whatever you are saying about the economy, it is not like that. During Doomso, we are talking about COVID-19 in 2020. Kojo Ponkruma is making a reference to Doomso. How stupid and ignorant can an information minister be? This one is not, this is common sense 101. This is basic. We are talking about COVID-19. What plans does this government have? 5 policies that it's solid. We are using 2 today. The 3 is a backup. You can't tell us those things. You come and tell us that some people manage through Doomso. Those idiots who manage Doomso, they built all the hospitals around you, are telling diplomats to go and sleep in. So how foolish are you to come and make such a statement? And I always say, these people don't respect us because they think that they are smart. They are not. They are dumb. You say somebody oversaw Doomso with the worst economy. That person has built hospitals that is going to save your president today. And you, Kojo Ponkruma, it will save your big head and your ass if this virus gets you. And you are not shy to make such a statement. And you saying that you have all the men, you have all the knowledge, you have all the smart people handling the economy. After 2 weeks, the economy is down. You go to IMF for billions, and you are not shy to come and make such a statement. This is where we are. The politics of victimization, the politics of tribalism, it has lowered our politics for ignorant souls to lead us. That is where we are. Who is he? Mahama Weteni, Ninya Ibrahim Mahama Yewi. So At the end of the day, whatever Mahama and his administration do, we will not see it. But who is he? Oh, Nane Akufo-Addo. Oko law school UK. Nane papa ex-president. Akufo-Addo had onya hwe kra ye nipa no. This is the level of ignorance and idiocy with us. How can a whole party like the MPP call somebody like Chairman Wontumi to lead them as a regional chairman? How can a party like MPP, a Dubois MPP, Kufo MPP, call somebody like Abronya DC to lead the people of Bronga Hafo region? These two people, when you sit them on a table and ask them, tell us, give us ideas, plans, policies on how we can fight this COVID-19, they can't give you a rational answer. Madness. The only thing they will say, John Mahama is mad. John Mahama can't be president. These are fools. They can't help us. Go and call this regional chairman and ask them on radio, say, what are your plans as a regional chairman? Basically, you are the head of the whole region. As an MPP rep, what policies, give us some ideas on how you think if this hits Kumasi or the Ashanti region or whatever, your little plan, policy put together. He can't give you one. And such a person is leading the great NPP party I belong to. And I shouldn't be hurt. And I shouldn't be hurt, my fellow Ghanaian. This is the problem. You have people like this as regional chairman. And these guys, when you say regional chairman, it's not a small position. But when you put madmen in positions like this, that is why you can't get solid ideas from the base that goes up there to fill the bosses for them to just have simple deliberation and know the cause of problems, the how to antidote to problems. That's why when you have mad dogs down there, they cannot send any reasonable signal up there for the people up there to make very convincing decisions, because the regional chairman, the regional Ashanti regional chairman, he does not understand COVID-19. When people start to die in the Ashanti region and they ask him questions about COVID-19, he doesn't understand. He's a fool. So at the end of the day, by the time the information gets out, because even if they give this guy information, he wouldn't understand. He would see it as a killer paper, and he would just go out there, and the first thing he can do is go after John Mahama because it is the easy target. But you see, my problem right now is, where is the leader? Where is the leader? Where is Akufo-Addo? When is he going to meet Ghanaians? The teleprompter, we are tired. We are tired of the teleprompter. One day the teleprompter will go off. We will record. The teleprompter acting. It is too much. Hollywood Cry has been shut down. The makeup and the teleprompter and the light and the fellow Ghanaian, it is too much. We want you to calm down and meet us. We gave you power, Mr. President. We thought and we believe that you have all the wisdom because you are being briefed every morning. Come and speak off your head for us to know that you have an idea of what is happening. Don't let some young man plagiarize somebody and give to you to read and embarrass yourself. That is the problem. We don't have a leader in Ghana. That is why today, when the opposition leader is speaking, the whole nation is listening to him. And let's be fair. Let's be fair. Everybody now wished John Mahama was president because he is speaking like a leader. Let's be honest. I'm an MPP person, I'll tell you. If you are going to be very honest in your heart to accept, everybody wished tonight, this speech he made, if you are very genuine to yourself, you want a leader who is going to, this is what Akufo-Addo is supposed to be doing. What Mahama did tonight, that is the job of Akufo-Addo. But you see, the opposition and Ghanaians are beginning to realize that the president is empty. The president is not on top of issues. The president cannot, and I swear to God, I don't think Akufo-Addo will ever get involved in a debate with the opposition leader. He can't, because you see, we have followed politics for a long time. There are some people who just want to be president, and there are some people who went through the mill to be president. So when they are there and they are talking, you see the difference. I'm not here to campaign for Mahama, but sometimes some people, when they deserve some credit, you give to them. Akufo-Addo did not have time to study Ghana's politics. He did not have time. The only thing he loved was to be president, and then that's why he picked a bigger position, Attorney General. But he did not go down there to understand the procedures and the process to build a government. That's why anytime Mahama speaks and Akufo-Addo speaks, you see the difference. Even though Akufo-Addo is president, his speeches are weak because he is not on the ground. He is not a politician. Akufo-Addo is somebody who wanted to be a president. He is not a politician. That is the problem. That's why anytime Mahama makes any statement, it takes over the headlines. It is because it takes a long time for reasonable, rational people to understand it. You need to sit back. I remember somebody asked him a question about the SNIT thing. He said, the policies are there. We could amend them in Parliament to favor the ordinary Ghanaian who is paying SNIT. But you see, it takes people to sit and analyze statement before they will understand. Because when people have gone through a mill, they've gone through Parliament as MP, as as Vice President. They know how the system works. So that person will not stand on the stage and tell you, say, I'll build 88 hospitals, when he knows that that policy, that thing, that idea needs to go through a mill before it becomes a project. So you see, we need to start analyzing these people. We need to start sitting back and analyzing things for ourselves. Akufo-Addo just wanted to be president. I don't even care about that. My issue is, as we speak, and John Mahama said it, we have only one president in Ghana now, and he is Nana Addo Dankwa Akufo-Addo. He is the first gentleman of the land. Where is the leader? That is the problem. Where is the leader? I am not here to fight the leader. I am here to let the leader lead. The leader lead us. Where is the leader as we speak? Now, tomorrow morning, go on the various radio stations. You will see the conversation will tend to, so he built a hospital and so what? There was Doomsaw. But that person say he built a hospital and so what? Doomsaw, no, it was during Doomsaw's time when all these projects were done. So then at that point, what are you okay as a human being? That tomorrow morning you will see the Kweku Baku come and sit there, and then he will start. During Mahama's time, yes, he didn't. This one is for Akufo-Addo because Akufo-Addo came to complete it. This one is, that is the problem we have now. Yes, and then the very ignorant ones, the very foolish ones. Oh, so what about the Airbus? You see, that's the problem. Your own special prosecutor, he has become a bulldog. He can't even bite. We are in the middle of a crisis, and we don't have a leader. That is dangerous. That is very, very dangerous, my fellow Ghanaians. If you don't like me, let me tell you, you would die. You sit there and do MPP, NDC, yeah, MPP, yeah, the Asante for, yeah, the account for, yeah, you will be wusa punching. And the death is going to start very soon. That's what I'm telling the pastors praying. We are doing fasting. Enough of that. Stay in your room. We are tired of the Facebook pastors doing prayers, putting towel on there. We don't like it. Call the president. I'm talking to the bigger pastor, Duncan Williams. Yes. Pick a phone and call the president and say, Mr. President, it is left with common sense. Let's apply common sense and do our own prayers at home. Because where it is getting to, it started from 57. You lock down, you open, now we are 2004, 2074. Where are we going to get to in the next 2 weeks or 3 weeks? And you are sitting there, Jesus come, Jesus do this. Jesus gave you common sense that, you know what, when things happen, shut the borders. That is what Doug Hayward Mills was telling you people. Now, you go for a meeting, you take him out. Do you think it affects him? He has spoken as a man of God, and he has been honest to Ghanaians. Doug Hayward Mills, he spoke as a man of God who believes in truth. So, you see, the country has become a country whereby comedians are the ones who have access to mic. They have access to platforms. So they throw trash out there. And you see, people are too busy looking at other things. I say if you later go and search, you will see the platforms. Do you think Mahama was too rude to the president? Who cares? The Mahama was blaming the MPP for not building the hospital. At the end of the day, have the hospitals been built? At the end of the day, when you came, was the contractor there? Why didn't you make him work and do your investigations alongside? Don't you think Mahama was so rude to say that? This is the stupidity of the ordinary journalist who thinks wearing suit makes him intelligent. That is the problem we have in Ghana today. They will go and not look at the positive side of how this thing started in the first place. Let me tell you, if all the projects Akufo-Addo and this NPP government have belonged to, we came to inherit, if we had been able to complete it, NDC would have been done. Now where again for MPP? Now nowhere for NDC again. If we had completed all the even 70% of the project Mahama left, NDC would have been done. But you've not been able to do it. Then you come and tell us that you want to build 88 hospitals. And then today we are 2,074, and Doug Howard Mills tells you that you were being ignorant because the signals were there. He was telling you people, shut it down. The next day you make him a victim. You call in another pastor to fill his seat. Do you think he cares? He's a doctor, for crying out loud. He has his own church. In fact, you see, he's one of those pastors I respect a lot in Ghana, because I see this man going to villages to do crusade. I have followed him for a long time. I'm not a lighthouse person. He goes to Kenya, village, remote places, trying to win souls. That is what you people have to do. These people put a boy in their head and they follow the president, Duncan Williams. He flies first class with the ordinary Ghanaians' taxes, flies with the president to the DC and come and solicit money, take money from Ghanaians that we are going to build a cathedral. And then they take the money back, they don't account to anybody, and then he sits there and says he's a man of God. That is why I have problems with people like that. That is my problem. The man of God at Lighthouse told the president, and he summed everything up. What is the word he used? Ignoramus or whatever, right? He used one letter to represent a whole government. Because when people start to die, they are not going to die as Lighthouse Chapel members. They are not going to die as Kotoko supporters. They are not going to die as my own club, Ash Gold supporters, or MPP or NDC. They are going to die as Ghanaians. So we have to think as Ghanaians first. And you people, because you think politics makes you wise, you fail to take wisdom. You apply stupid senses that will not benefit the people. That is why today you have 19 people or something dead and 2,074 people who have the virus. We are a third world country. Legon Hospital, only one part has been opened. We have all seen the pictures. What is wrong with you, Mr. President? What is wrong? That is the problem. Today, somebody's right. Paul Ademotre has activated phone lines. He has no option. The space is too hot. It's too tight for them now. When was the last time you heard that Good Evening Ghana takes phone calls? We are setting the pace. It will get to a point you will start smoking weed on air. That is the thing. And we have to come together as a people, irrespective of our political affiliations, and speak to the issues. Ghanaians are stuck out somewhere. They can't come home. We even living in the States. We can't. I come to the studio. I can't even meet my producer. I can't meet my team. We are talking about Ghana. The question is simple. The NDC, their flag bearer, has come out with clear-cut evidence and clear-cut policies and clear-cut vision. What is our vision as a political party, NPP, and where is the leader? Today, if you ask them, let them come in the morning. And you know what hurts? These radio people, nobody will ask them, what is with you? Okay, fine. Mr. Information Minister, sit down. Let's sit down. Apart from wear nose mask, apart from use sanitizer, apart from observe social distancing, apart from what is the government what are the clear policies put together? Then you come and host people in 5-star hotels and say Ghanaians should come and pay $100 million. The problem is not us. The problem is that we are too ignorant to know that these people are deceiving us. Our ignorance level is too much. Politicians are not God. Politicians were not created differently. Politicians started like you and I. They use words to get to where they are. So when they get there, we know they are not competent. Let's get rid of them and get people that they are ordinary human beings like you. They are not superpower humans. No. It is simple. I said today, after we all watched John Mahama, I am not. You see, let's be real. I'm going to tell you. He spoke like a leader. He spoke. Everybody thought that Mahama was the president. I saw somebody send a message. Why do you put a flag behind you? That's the thing. We don't have a leader. Where is the leader? The leader cannot speak. The leader is always hiding behind a teleprompter to take words from a young man who is being paid at the Jubilee House to read plagiarized statement. The president cannot speak over his head. He cannot stand in front of journalists and take questions on health, take questions on detailed issues on this health issue, on COVID-19, the statistics, and how we are prepared as a nation to stop this, even though, fine, in the first place, we made a mistake, the thing is in here. The president cannot, he cannot process these things. Why? He is not ready. He's not on top of the issues. But sir, I have lived in about 4 countries. I live in the United States of America. I know presidents, how they are scrutinized. I know people have problem with Trump. Apart from all the job he's doing, they have their own problem with him. Because as a leader, one, you have to be influential. And not just influential in your outlook or in your statement, because every statement you make as the president of the United States of America, it either kills people or makes people live. There are 2 things. So as a leader of Ghana, every little statement you make, it either makes somebody live or makes somebody die. Where is the leader? Where does he stand? What does he know? What does he believe that we can do to save each other? We don't have it. We don't have it. So that's where we are here today. No clear-cut policies from the MPP government on how to tackle this COVID-19. The only clear-cut policy, let's put together a COVID-19 fund. Let's go to IMF and take money. Let us tell Ghanaians that people who came to sleep in the hotels, $100 million. What are the policies that we can say that today we have put 2 policies ahead of us? The virus is going to face it. If the virus defeats those 2 policies, we have 3 more policies that we have put. You see, that is what governments do. Come to America. They do one, they're like, no, this one, we need to have a backup. That is how governance is. There's no clear-cut policy. There's no. It is all about sanitizer, distancing, nose mask. Then there is no. You see, they tried one. When they tried one, the economy went on its knees. We are going to share food to everywhere. How do you do that? What's the policy behind it? What's the strategy? What is the basic, strategy to make sure every single Ghanaian who is below the wage level, the poorer of the poorest, as the president said, how are they going to get access to these food, these dry food, not already cooked food? Because we are in the middle of a pandemic people can get infected through just touching food or anything. They don't have ideas. There's no idea. You see, it's all about English. It is all about bow tie. It is all about, I went to school in UK. I have PhD. They don't have common sense to apply. Where is even your vice president? Where is your vice president? Where is Baumia in all this? Where is he? That is what we have to be thinking about. We should not let some journalists who, through politicians, have become billionaires. These people, they have duped politicians and duped Ghanaians to become rich. These people are greedy people. They come and sit on TV and they have a clear agenda. No, we have to think as people. We have to think. You see, every day I keep telling you, when you come on my show to watch me, don't take everything I say. No, do your checks. Go back. Kevin said this. Let me see if it is true. Let me check the tabloid. Let me do my own check on. Let's do your checks. Go back. Sit down. This is what Kevin said. Is it true? This is what he showed. Is it true? That is what you have to do as a human, to make your own deductions and decide your own future. I will never impose anything on you and say, this is the truth. No, listen to me. I'm giving you the facts, but don't say it is the 100%. Go and do your checks. And when you go and do the checks and you come back, then we know. I say, when you meet these, my own MP people, ask them, radio, TV, give us 5 clear-cut policies that is there that is going to face this COVID-19. They can't tell you. 1, wear nose mask. 2, clean your hands with sanitizer. 3, observe social distancing. 4, we will see if we can share food. There's nothing. See this gender minister. She doesn't even understand what is happening. The gender minister. She used to be an undertaker. Politics. Go and bring Chemaun to me and say, Chemaun to me, don't make a statement about John Mahama. We have COVID-19 now. Tell us, as a regional chairman of the NPP, Ashanti region, tell us, give us 3 clear policies you think can help solve COVID-19. No hand sanitizer, no nose mask, no social distancing. Ultimate kasa. The only statement you make is John Mahama is a thief. He doesn't have anything. Now you induce a level no. Now you sa. Adwene sa. So adwene induce a level. Adwene sa. That is the problem. Today, I saw Kennedy Japan paying his way through media houses and flexing his muscle, and of course, Happy FM. And you see, I'm one person. I have watched this guy, Kwame Fifa, of Happy FM, every day. This guy, you see me, once in a while, I watch some radios and stuff. I watch them from behind. And I see him, emancipation. Emancipate yourself from mental slavery. We are going to take on these politicians. We need to ask them questions. We need to make sure that when we see them, you see, you the youth. And I was like, oh, this guy, okay. Today, Kennedy Japan came on his show. And then Kennedy Japan told him that you invite Kennedy Japan to your show as a journalist. And then Kennedy Japan sits on the show and tell you, oh, the MPP time, no. What happened during Ebola and what is happening now is totally different. During Ebola, it wasn't crazy. But this one is pandemic, so NPP has tried. Not to. And then Kennedy Japan was like, go and ask the NDC. Parliament gave them money to fight Ebola. Where is the money? And as a journalist who is going to interview somebody, don't you have your facts? You don't know how the fund was used? You don't know how they used the fund? And he sits there, like, I don't know. And I was like, damn it, this guy, are you serious? You are my guy. I've been watching you. You have shown that, Jack, difference behind him. You bring. So Kennedy Japan felt, say, no, he has met a weak one. He's going to use it. Then he was telling him, go and ask Mahama, say, fund the man with Ebola time, no day. That is the thing. And as a journalist, if you have questions in front of you, you don't do your checks before you make a liar like this come sit in front of you. And Kennedy is blowing hot air. And then Kennedy is making outrageous claims that he's lying and cooking things up. During the elections, we stopped them. And then STL. And I was this guy. Yes, I was out there. Now me crampo me strong room. What? Where are your evidence? Mr. Minister, where are your evidence? And they allowed these people to come. So I was watching this. Okay, I was like, man, you are just making noise. You have nothing. You are empty. You make Kennedy come right over you because you don't know what you are doing. If you're a real journalist who is ready to interview people, interview politicians, a politician to assess him and break his brain down for people to understand the kind of person he is, you don't be sitting there and say, I don't know. And he asks you that, what did they do with the money they gave the NDC administration to take care of Ebola? And you didn't research the night before? Now, but not TV, so emancipate yourself. You make sure that Africa and at the end, you sit in front of a liar and you are pampering him. You my guy, you are my guy. I used to watch your show. You can ask this guy so many questions. And he was trying to move to a religion. You see, you guys are our problem right now. Okay, Jeffrey, if I'm talking to you, I'm disappointed in you big time. You are going to interview somebody, you have no facts, and you make the person come spill nonsense, and he walks away because the moment he sat down, you started interviewing, he realized you were weak, you were hollow, you didn't have anything. Until who said, no, I've gotten a weak one. Kennedy can't sit on my show and say STL and what they did. No, you need to show me. You can't just sit on my show and say, yes, they gave money to the last administration, and that because what did they do with the money? A member of parliament asking me, and then a journalist, you have no facts, and you are nodding. Jesus, don't come and do this. We love Ghana youth. We are progressing. Emancipate your life. Don't come and do that. That is the problem we have in Ghana. People think they know. And with all due respect to Okatache Frifa, I've watched you for a very long time. Honestly, you convinced me to a point that I thought, Jack, if you get these people, you split them up for Ghanaians to understand that politicians are not superhumans, and that politicians need to answer to the people, and that they need to have facts, because that is our problem now. You see the reason why today, as we speak, no past administration, no one is in jail. You know the reason why today hospitals are being left to rot? It is because we spoke without facts, and the journalists took those things, no fact, and threw it to the people. So the people got confused. Who is telling the truth? We have the platform to to interview people, assess them, and break them down so that people listening to them will understand. But then when you sit there and you make them come detect for you, if you don't prepare as a journalist, do your checks and just ask questions for asking sake because you belong to the same political party, your credibility is on the line and you lose that value. What's that? Okay, what's that? Honestly, me friends say what's that rough? What's that papa? What's that too much? And then I was disappointed. You could have asked Kennedy upon. These people are saying, you kill JB Dankwa, the CID has the report. Why are you not using your flex to tell the CID to come out with a press conference to say that you are not in there for you to be exonerated? Then you can kill that story. You are sitting there and doing, and this Kennedy Japan was telling you, and you cry, your boss, your FM station boss, he helped us win the election. Is this a party conference or an entertainment? Ghanaians, that is the problem I have. Okay, the Jeffrey for what's some what's some rough. They be emancipate yourself from mental slavery. And I did and Kwame Nkrumah did this rest a company, and then this industry has been destroyed. And now one nipa na busan questions or Kachra will say, you don't do your checks, you don't find your facts, and you sit there and say, I don't know. Now what's boss? Serious time, so you group you move. Jack, Mammy quote too much. Do your job. Make sure you prepare before you call people on your show. Because people like us, when we watch, we don't just watch. We analyze the issues. Get what I mean? Tell your team to do work. Work hard, boss. It's not about it speaking, but everybody can speak, but it's about the knowledge that comes with it. And I have been watching for a long time, man. I respect you, but I'm giving you a very friendly advice. I've not met you before. Men sang to us. Chawon sanso. What's too much? All right, producer, I can take my calls now, right? My producer, I do some time. Oh, cool. All right, so the number is +1 202 751 8769. +1 202 7. In fact, I'm not going to take the calls now. Producer, my producer is gone. So, producer, what I wanted to do is I wanted to give somebody $20. There's a gentleman who took it upon himself to go and record. Police, are we good to do it? Yeah, so, okay. I can't even find, I think I've got it. Yeah. There's a gentleman who took it upon himself. Before I pick the calls, let's do this. You see, I've been telling you that don't let the people tell you what to do. Producer, I'm doing this to give you a little bit of time. I've been telling you that don't let the people tell you what to do. Do your own checks, find out for yourself, and then let other people know the truth. It is very important because we need to build a nation now. We cannot build a nation on lies. We cannot build a nation by victimizing people and putting people in a specific category. No, we have to start doing our own checks, doing our own fact checking, and then coming out with answers to influence our decision at the end of the day. I told you this week that we will be taking videos from people. Go to locations you think the NPP government has abandoned. Go to locations you think the NPP government is actually working on. You see, it's not just things which have been abandoned. If the NPP government is doing a project which you think is a project that is going to positively impact the lives of Ghanaians, go there, go to the location, film it, tell us the history, and tell us a short story about it, and let us know. We will show to the world. We are here. We are not going to mince words and say, if there's an NDC project which has been abandoned, you want to talk about, go there, 5 minutes, film it. Tell Ghanaians, you live here. This guy is all the way in Wa. He took upon himself to go to the Wa Regional Hospital. He was not allowed to enter, but he showed and he spoke to let people know that this is where he is. And he also went to the Wa Airport to tell Ghanaians, to show Ghanaians on camera that this is me, this is my name. I am going to show you that this is real. Yes, his name is Eric Anayi. That's his name. And in fact, he wins $20 today, which I am going to send to him for doing this, because it's about time we started talking about the issues. So he did it himself. He took it upon himself to tell his story, his little story about what he knows and what he has experienced. So he went to location, went to the Wa Regional Hospital, took a video of it, and went to the Wa airport, which was done by the last administration, and sent us a video. And we are going to play it to you very short. Producer, if you are good, we can do it. All right. So my producer is going to show you two different videos, and then after that, I'm going to give him $20. Even though he didn't do more of an explanation of the project, I'm giving him $20 for going to the location, filming, and sending to Loud Silence Radio as to show to Ghanaians that he has done his part as a Ghanaian and he has spoken the truth.
Started in 2014. Today it is here. This is also the new Wa Regional Airport. The Wa Airport being renovated by Mahama. Today is being used by domestic airlines within the country. It moves from Wa to Tamale, Wa to Kumasi, and Wa to Accra, and the vice versa. This is the entrance of the Wa Regional Hospital, newly built, started by John Dramani Mahama. Started in 2014. Today it is here.
So that was a video from Eric Anai. He wins $20. The reason why he's winning $20 and not $50 is because he did the video. I think he didn't have time to do a lot of the explanation and you know, the location specifically and a little history about the project. So we're going to give him $20 for his transport and his time. So in $20, I think in Ghana cedis about a little bit over 100 Ghana cedis. Eric Anai, he showed the Wa Regional Hospital and the Wa Airport. As you can see here, Eric, after the show, your money is going to be in your Momo account. You actually sent me your Momo number, and I'm not going to say it online. I'm going to make sure you get it. And tomorrow when we have a show, you can come on air and also let Ghanaians understand that it wasn't no libi-libi, no laba-laba. So as you know, if you have a project behind you, around you, a project in your constituency, in your region, a project that you think the current government has started, that it is really going to impact the lives of people positively, or a project that the last administration started that the government has neglected or the government is working on, let us know. Do a less than 5 minutes video of yourself, 2-3 minutes. Tell us about the project. If you can go in there, show us things in there. Let us hear your voice, and then you stand a chance of winning 20, 30, 40, 50, all the way to $100. Depends how solid your presentation is. So that is it. Eric Anai reported from Wa Regional Hospital and Wa Airport. Now, what we're going to do now, we're going to pick some phone calls. Let's see. Hello, caller.
Hello.
Yes, go ahead, sir.
Okay. Am I with
You are live, sir. You are live. You can speak. Yeah, you're live.
Okay. I want Kevin Taylor to know that if the NDC government has done something, they should say NDC did APC. They should, and when MPP does it, they shouldn't say the politician. They should say MPP did it well.
Okay. Thank you very much, sir. Sorry, the line had to drop. I'm sorry, but we get your point. Yeah, you still here?
Yeah, Pacho, if you're Ben Cassafree,
Ben Pacho Casa.
And then no Mahama Chess were a good leader. Papa. They say, and near more there to come to say, yes, Papa, we or vision, Amagana. And they say, Abronia Cotana, ne two, was a some Casana Nalus, so you. Not Chama to miss the or the Tabia to come in and Kumatina in the Munkwa, the party, to say MPP. No. Regional chairman to say Abronia, who was me renew less lesson. To me, almost new ideas.
Thank you, sir. I'm sure. Hello, caller. Yes.
Hello, Kevin.
Yes, sir. Go ahead.
My name is Philip. I'm calling from Canada.
Go ahead, sir.
I think Mahama did well with the speech. I congratulated him, but whatever he said, I bleed within myself to be a Ghanaian, and all these things are there. These people ignore them, and they keep on lying to us every blessed day. To me, I think he deserves to be applauded. Thank you.
God bless you. Thank you too, sir. So the line is +1 202 751 8769 +1 202 751 8769. I have a caller on the line. Hello, caller. Yes, sir. Go ahead. Good evening, sir.
But every maybe happen because of their numbers in a call. Maybe
yeah.
Maybe I could not feel crying. Me, Yan say, is the woman is beer or moye. Oh, the guy was beyond Casa. Beyond Casa. That Christian cancer, that Indian cancer beyond Casa. No beer killing.
Yeah.
Maybe I want I tell you, maybe I hold off because I didn't be a corner there. I don't know. I mean, what I'm sure.
I'm sure. Yes. +1 202 751 8769. Hello, caller.
Hello, Alaji. Madam Kevin Hotel attending.
Monica, good evening.
Good evening. Nagajia.
Nagajia. Answer ne day. Naga crotch.
Alhamdulillah, yanzu mutane Ghana muna cikin azumi. Mun duka mu yi guda mu yi wazi mu tambaye Allah ta ba mu president mai kyau. Mutane mai kyau sosai su bi mi Ghana, Africa ta bi kama Kule. Before Trump, I'm going to
Fanti.
Master American, the 6 year. Yamine Huma Barisi, your fast room, young bomb pay. Na young papa Mehen, President Papa, and you Papa, no one's the Ghana, no African man. Nahan see young Korea there, Abu man. There, Inta Allah.
Thank you very much, Auntie. I'm sure. So that's one thing I have to say here. You can speak any language you want to speak on this show. Yeah, 1 second, caller. I'll get back to you. Just be on the line. Don't go. I want everybody to understand that on this show, you can speak the language you are comfortable in. Any Ghanaian language. Any Ghanaian language. It is not restricted to only Chi and English. Kasebia, we are comfortable. No? When you call, you can speak on this show. All right, caller, go ahead.
Mr. Kelly.
Yes, sir.
Me Castafe, Barcelona, Spain. Me did Nashir Mohammed. The President Mama, I'm making me deep. I'm Kupo Shira, no Shira was your Jumapawe.
I'm sure, sir.
I brought you on Tramona on the more. With Tramona, no other talk can quite happen. When we are brought you any part. Me did a table for a Bema on table, a table for a channel. One or call us on Pura and Kubukuno. Well, Bema will come back today.
I'm sure. I'm sure. All right. Hello, caller. Yes. Hello?
Yeah, hello?
Yeah, go ahead, sir.
Yeah.
Yeah,
Kevin.
Yes, sir.
I'm calling from Germany, eh?
Go ahead, sir. Yeah.
Yes. My name is Pascal, and actually my wife used to call you almost every day.
Oh, okay.
What I have to tell you is you are doing a great job, but I want to give you my Momo number because I like the report from WA. Yes. Oh, just kidding. Today I think Mahama showed what we call leadership.
Yeah.
Yes, he showed what we call leadership, and I also want to say, all you are trying to explain to the family, it's in the pipeline.
Okay.
Yes, it's in the pipeline, like they keep saying, because Akufo-Addo is sleeping. Perhaps he, the guy who is working for him, when they knock on his door in the Jubilee House, he's sleeping. You know, so he can't come out to face the people and answer questions and work for the people. You know. So I just want to leave the line so that other
Thank you very much,
callers
sir.
will
Thank
also
you.
have.
Thank you. Have a wonderful night.
Faith.
Hello, caller. Hello.
Am I live?
You're live. Go ahead, sir.
Okay, Kelvin.
Yeah.
So, good evening and big up to the crew.
Thank you.
I would like to. I happen to chance upon your words on here, your status. It says at some point you will have to stop running, and take a stand.
Yeah.
Either your children or your grandchildren, better than them. So it's very unfortunate. My fellow Ghanaians, I'm deeply humbled, but rather sad. You see, this MPP government, so they made all of us to believe at the time. They deceived us, they lied to us. You know? And most of us, I mean, I, for instance, I'm an NDC guy. But it got to the point where, like, you know what, we're going to have NPP come to power and, you know, give them a try. And the deceitfulness, the propaganda, I mean, it was just too much. You know? And now you guys are in power. You've deceived the whole nation. It's sad. But I'm hoping Ghanaians have woken up and they've smelled the coffee. So let's, to my fellow Ghanaians, please, let's rally behind this man, President Mahama, and vote for him. Come 2021, Ghana will be at a position whereby each and every country surrounding us will know we are a country of vision.
Thank you very much, sir.
President Mahama. Yeah, thank you.
Have a wonderful evening. Hello, caller. Hello? Yes.
Good evening.
Good evening.
Can I contribute?
Yeah, go ahead. Yeah, we can hear you. Go ahead.
Mr. Kelly.
Yeah.
You told me that because of the loan. No. No, they are any matter my own country. All the than make your presenting a and I make you in some of that, but I wish that. Hello?
Yeah, hi, it's you. Yeah, hello? Yeah, I think she's struggling with her line. Sorry. Hello, caller?
Hello, Mr.
Yes.
Kevin.
Go ahead, sir.
Good evening.
Good evening, sir.
Yes. This is Abdurrahman from Sweden.
Go ahead, sir.
Yes.
Okay, make a tree.
Patrick tree.
Yes. The other person mechanic say, Bobom Homadin Pa or Jumadia Woody. Now, one say, I am come for I can be said jihad. Oh, jihad, a biana, oh, you know. Because the meaning of jihad, they say, we you uncrow for, and I say, Okon Ekopa, Ediama uncrow for. And a beer, the Aoyan, a beer, no kwa so ano and they say bi yes so ayaje ebusuafo wo fie a ye tu kwan aba han be pe bibi e de aboa mo so wo fie ni nyina ye jihad.
Okay.
Enti ani bi a wo so de magana for any say bi ye no ma ye wa gochira ye nim de e koso a wo enlighten ni nyina ye okompa na bi no. Enti nyame nkoso nhira ono mbo ho ban. Nina young said the econo or money a here in society, celebrate our money between Tumpon, Amayina. Because if you're from who told me, yes, I want to after.
Thank you, sir. Thank you.
Yo.
Hello, caller.
Hello.
Yeah, go ahead.
Yes, I'm calling from the USA. I'm a citizen of Ghana, and then my problem is we are talking about lives here. You've been talking, I'm watching you. My main problem is that corona or any other sickness that we don't know might come our way. And it has no respect for anyone. What is our leaders doing? I don't care about MPP, NDC, or whoever, be neutral. Why don't we come together to fight this, to find solutions, and stop accusing leadership? You were telling me that there's a guy called what? Coming from this registration, whatever. Are we done? Are we stupid? Can you walk to the market to get a life? People are dying. They are not giving us the right figures. And Ghanaians, we are sitting down. I want all Ghanaians to say no, 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 no. It's not about you, Kevin. It's not about anybody, but it's about us. I don't care about who is the leader, but my problem is I care about who is going to be alive.
Yeah.
If we are not alive, who is going to vote for you? They are stupid. They are dumb. They don't think about it. They only come when it's campaign time to come and talk to people foolishly. It's no more. We are not taking that again. So they should leave that. MPP has given you money, NDC has given you money, you are coming to talk. For instance, maybe when you were talking, I like the way you were saying it. Hey, Muhammad came and spoke. Fine, let's say yes, he did it. So I'm expecting Nanado to call on Muhammad and say, thank you for that idea. What can we do?
Yeah.
That is what a leader should do. Leave your pride, your money, your education, and what. Corona has no respect for these things.
No.
Let's come together as one and fight this thing. That is when we say we are citizens of Ghana and stop them and stop beating about the bush.
Thank you very much. Thank you, ma'am. Thank you.
Thank you.
Have a wonderful night. Yes, so people are really expressing. Yeah, producer, it's not easy. Yeah, it's getting to that point whereby we have to start speaking, man. It's not about who is president and who is not. It's about how we're going to save human lives. Very, very important. How we're going to be saving human lives. Anthony T.K. Nelson says, NDC lost to the local media. They massively work for NPP. NPP can't match great NDC. Okay, that's his opinion. Let me see. Lion Gumash says, he was replying to somebody. Mabia Damba says, Auntie Monica. Auntie Monica, you make my day for speaking Hausa, but Auntie Monica, please, Dagbani also for me. All right. Akoto says, I was speechless and nearly wept at the end of JDM submission. Superb delivery. Thank you very much, sir. Thomas Finn says, in every age and every generation, some few individuals stand up and they become the standard and symbol of enlightenment and inspiration. There is something distinguishing about these individuals. One, they suffer so that others may prosper. Two, they plan so that others may reap. And three, they go through pain, sweat, and tears so that others will get laughter. This comes from Thomas Finn. That's a good one. Lydia Nyama says, all the journalists in Ghana have been influenced with money, so they can't ask questions when the politicians come to their shows. That's her opinion. Let's see. Kwesi Chireme say, you are doing a great job. Keep it up. Thank you very much, Kwesi. Irene Klodzi is also speaking here. Let me take this call and go back to the text messages. Hello, caller.
Kevin.
Yes, sir. Go ahead. Good evening.
My name is Sean calling from Boston.
Go ahead.
Kevin, no follow show you for a very long time.
Yeah.
And this is the first time I'm making.
I'm sure.
Okay. Make sure some interview with people here with Osama Bwade and one NDC guy for the tampon, right? And the tampon guy was saying that them stabilization fund here for the bay, MPP using that wanted to get MPP there for 4 years. One for 1 cent in Bonyade. One for the account. Or Premo of Osama Bwade. Le Omeyana in my father. Okay. One face to be anti for next crime. Ghana may be any more on my home Sunday. When the country is in need, the one who has a child. I think these guys are just joking with us. This is the time of the Ghana.
I'm sure also. I'm sure. Some messages here. YouTube guys, I'll come there and read your messages. I'm sorry. I know I've left you guys behind a little bit. I'll come to YouTube and read a few messages. Hello, caller. Okay, let me do this.
Hello.
Yeah, go ahead, please.
Good evening.
Good evening, madam.
Ukru members nyina nyankopon mbo wo ho ba.
Amen. Yedase.
Nyamembo wo ho ba na wa ya dedodo. Wa menye sha ye wa brochi no ye hu ma olokodo. Na Kevin Mr. Pede ka kire ganafo. Anytime be a program be a photo when enim da obi a wo be poi wo be kada wo be registration bia mo bia lampo.
Yeah.
One mad ministers na wo family. One caution line, no one register. No one could vote. I'm back. I will put a work for two. No one. I won't could you know one two one other because the Arabana Waba or a day yet Ghana no who first. I am Bonnie Pano Bana, one of pay Waba register. One of pay Waba to Waba. Oh, here, no. Oh, no more. Oh, here in the Wabakade Wadan president. Saboda Allah, Saboda Nabi. Manimu Kanimu. Chiwa Nangaskianu. Akwai ciwo akwai shi ana mutuwa sosai don shi kowa ya sa hankali especially mu yan zongo mu sa hankali sosai kara abara za a ce mu fito ku fito kar kowa ya fito manima doro ma bien wo doro ma nyala yamangle duzo so kam lihmo man vin yalanga so kam lihmo family vin yalanga di chaka so yu hanya ni yina tinan ban sha din tiyan zan wahala tinya berin tiyan chaka family soci kaban family jiya duzo so kam lihmo man vin yalanga so di chaka so yu hammo no yimna tizane in register voting ID card be ban sha so di saka so yu hammo man ne mariya chashel ni yalya galama Mr. Kevin Medas.
All right. Hello, caller. Hello. Yes, sir. Go ahead. Good evening, boss. Patrick Kachi.
Richard. You should work there. What is the same that Ghana platform? No. Ejama and Nipa. That the omnium here, they were Kazakh or public. I know at times. Situation this now after they be at you, be out for the one of the Wakus too, and I said the only answer. I thought they didn't know about this. I was there, and I was in the power of the position. Yeah, thanks. The could be some pepper to put your position. The two bright you to not list. Yeah, sorry, the sorry, ma. Give me the Nasa, I will use the two. Ama, it's not the Ghana.
I'm sure. Let me take this on YouTube. Michael Dakon, the story building is. Hello, caller. I can hear you. Give me a second. I'll get back to you. Caller, be on the line. Don't go.
Okay.
Michael Dakon says the story building is accommodation for nurses and other buildings beside it is for doctors. Okay. Mima says you did not mention the number. Tistel Claw says, please, the dams. We want to see the dams. More info on those projects. All right, caller, go ahead.
Hello.
Yes, go ahead, sir. It's you.
Hello.
Yes, sir.
Mr. Kevin.
Yes, Unka. Yeah.
Yamisho. Yami Shopa, Nijo Power. Yes, so you can say Italy. Na sabi program de bi ye chi ya na yemfa na de nya kunya se frɛ Mr. Kevin program wo yande afi akoma so pa brother MPP for mu die hia because ye fia ye de nyoma kwakwa tax ye be tio habon ye ntumi what you say ye ntumi then akoso no then bone ba pa na Ghana for ye de yemu a mu die nya sa mu chichi nse fu ye chi ye gi ho se kwa na mu bu ye sim aden Mr. Kevin me throw ayana na mpesa mu yen say mudi mu ka sam na mu fa picture na mra
yeah the pictures mu
eduma pa yeah
let me show
mu fa mra sa na ye peno evidence na ye pe why
all right
yeah come on
so Calista Odonko she's the question is Kevin please can we send the video on the number okay let me try and pick this call and see hello caller okay so the answer is you can send the videos to this number +1 202 751 8769 +1 202 751 8769. When you call, you can send. When you make the videos, you can send it to the same number, and then we're going to pick it up from there. Somebody's going to pick up and then text you and have a conversation with you. So you can send your videos to this same number on WhatsApp +1 202 751 8769. Hello, caller. Oh, I'm sorry, caller. It's terrible.
Hello?
I just dropped someone's call. Hello.
Yeah, good evening.
Good evening, madam.
Yeah, how are you?
I'm good.
Thank God. Today I get you. I just want to thank you and pray you, and I praying for you every day. I'm just here calling you from Saudi Arabia. I'm watching you every day. God bless you, and God will give us some people like you. So God bless you.
Thank you. Hello, caller. I hope it's the caller I dropped. Hello, caller.
Yeah,
hello?
Kevin,
Yes,
it's me again. Yes.
Okay, so let's make it quick. Like quickly.
Yeah. Very quick. Again from Germany. Right now, my wife is sitting right next to me. I want to tell the family something very quick. We should try to patronate and donate for this young man who is fighting for Ghana.
Okay.
Yes. Secondly, I had an issue. Okay, I wanted to talk about the how do you call it? No, not COVID-19. Asla Wusu, but I'll do it tomorrow.
All right, so that's good. That's good. Yes. Thank you very much. Yes. All right, let me take the last caller, and then I can wrap up for today. My producer says you are the last caller. Hello, caller.
Hey, Calvin, this is Ghana Man. I'm calling from Pennsylvania.
Ghana Man, let's wrap this up.
All right, so let me make it simple. Okay. Today, you spoke my mind. Honestly, what I'm really thinking is this. I know it's going to sound silly, but this is what I'm thinking. I think this administration is lacking common sense. So this is my suggestion to the administration. I know Nana is going to be panicked and he's going to come up and give us promises. He should just stop. What he should do is they should allocate some of the money they took from the loan, the COVID loan, and buy some common sense for themselves. Sit down and think about issues, things that they can do right now to help curtail the spread of COVID. That's what we need from them. My second point tonight, just simple. My second point, just give me a minute. It's on what Kennedy Ajapon said today. I read a statement and he's like, NDC, the old like voter register gave them 1.5 million votes automatically.
Yeah.
And I did not even see anywhere where the journalist questioned him to prove how he thought that. And that whether in or sign, they are going to go ahead and do new register. You and who? I expect the news to just refuse and let the politicians go ahead and do the register, get COVID and die. COVID should be selective. I'm just putting COVID should be selective.
Very. Thank you very much, sir.
Thank you.
Mima, how do I call from the USA? It's telling me the subscriber is not in service. This is a WhatsApp line, please. Mima, it's a WhatsApp line. +1 202 751 8769. I'm not picking any more calls, but I just wanted you to know that if you call regularly, we're not going to pick because we have a specific reason for them. This is a WhatsApp line. +1 202 751 8769. So save it on your phone, and the next time you can just call on WhatsApp. Umar Rashid on YouTube says Ghana has no generational thinkers. That is why people like Nana Akufo-Addo can come and start talking about 88 hospitals in the pipeline instead instead of completing Mahama's project. Richard Kofiago, come on, family. Please like the show by closing the chat icon on your phone. Like the show and join the live chat again. Thank you very much, sir. I think Kofi is the deputy captain on deputy class captain on YouTube. Sandra Heteka, I don't know if she's around today, but Sandra, you have a deputy now, and he's really doing a good job for you. Sandia Mohammed said, please, where is the vice president? Who again is here on YouTube? Yeah, on YouTube, I can see Mima. Ghanaians must be serious about this trip we are taking right now. We need the generals in the medical sector to give us dates, not others. I think we don't have leaders. Okay, that's come from Mima. Now Adole Mole says, God bless the lady who just spoke. She is inspirational. Stay safe, stay blessed. Amen. My dearest, beautiful, blessed, darling Mahama. Okay, madam, sorry. First Dom 31 says, we Ghanaians must focus, think about the nation, and choose a good thinking leader. Jane Phillips says, hit the like button. Thank you very much, Jane. Who again is speaking on YouTube? Zaria Abdullah says, please, Mr. Kevin, we want you to do a program about ports and harbor. We can't ship goods to Ghana again. Togo is duty-free. Okay, I'll take care of that. Ike Laser says, Nanado cannot, and I repeat, cannot go into a debate with John Mahama. Never, and I repeat, never. Okay, so that's it. Fellow Ghanaians, the family, I am very, 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 very happy you joined me for the past 2 hours. We listened to the opposition leader, John Dramani Mahama. As you know, anytime the president speaks we show it live here on Laos Islands Radio and TV. So we are not being selective. We are just trying to let Ghanaians know the issues. Whether you like it or not, the contest is going to be between Mahama and Nanado Dankwa Akufo-Addo. So each of them, we have to give them the platform to tell Ghanaians their plans, to tell Ghanaians what they have in stock for them, to tell Ghanaians that they have better ideas to develop Ghana. So, hey, it's nothing unusual. Anytime the president speaks, we are going to play it live here. Anytime the opposition leader also speaks, we are going to play it on Laos Islands Radio and TV. No baga wire. It is solid. No baga wire. In fact, I would like to say thank you very much to the family. Thank you very much to everybody who listened to me in Ghana, in Europe, in America, in Asia, across the world. Thank you for calling into the show. We really respect your time. I keep saying that you guys are crazily good. In fact, I love you people because you have shown love. Even in difficult times, you have been there for me and the team. In fact, people on YouTube, I say you are family. All the guys on Facebook, you guys are family. People watching us on Twitter, you guys are family. We're going to do this tomorrow. Let me give you an idea of what we are going to be doing tomorrow. Tomorrow, I am going to tell you, if you know Kennedy Japan, tell him that, you see, I wasn't going to do this, but I have my team on his tail. And where he went the day I did the story on Sexy Don Don, the prison officers beating the guy in jail, that night where he went, I am going to tell him step by step where he went, the car he was in, the person he went to meet. I want Kennedy Japan to understand that I am watching him closely. And Sexy Don Don's issue, nobody should dare, from the high office to the low office. So tomorrow, if you know Kennedy Japan, telling him he should watch again. I have some nice information for him. This is not an expose. I am going to let him know that I am behind him. Every time he's driving, I am behind him. He cannot escape my eye. I'm watching him closely. So tomorrow's show is going to be interesting. It's going to be about Kennedy Japan and his evil plans and what he's doing with some individuals who are handling their Sexy Don Don show case. My fellow Ghanaians, I told you, we don't mince words here. Tomorrow, we're going to do show. Tomorrow, we're going to exhibit some kind of producer, the words are gone. But tomorrow, we're going to show the world that we have the facts. Kennedy Japan, it is your turn tomorrow. Pray. Pray, Kennedy. Pray. Ladies and gentlemen, I've told you, you guys, we are messengers. Messengers without a Bible or Quran in our hand. We are all messengers who are ready, willing, and very, very much willing to speak truth to power. Wherever you are, I'll say God bless you. Wherever you are, I say have a wonderful night and enjoy your night. Hi, my name is Kevin Taylor, host of With All Due Respect. As you know, With All Due Respect has been self-produced for the past 3 years. We have not accepted any money or resources outside in order to maintain the integrity of the platform. We are an anti-corruption platform. Our work doesn't excite or encourage compromised stakeholders. That also means we cannot take funds from just anyone. As our platform grows, the need for increased quality of work and production requires increased resources during this election year and beyond. In order to maintain our anti-corruption stance and continue to speak for everyday people without connections in higher places, we cannot rely on the same entities we critique for continually keeping their hands in the cookie jar to be the ones who keep our work going. In that view, I welcome your support and participation in keeping this work ongoing. This platform is for the people, so we think it is only right for the people to sustain it. Now, this is a simple thing you have to do. Just visit patreon.com/withallduerespect. patreon.com/withallduerespect, or click the link at the bottom of the video. For Ghanaians or our viewers in Ghana, we are putting together a Ghanaian payment processor on our website. Please again, do not send any donation to any platform apart from patreon.com/withallduerespect or loudsilenceradio.com donation page. You can donate as low as $10. Yes, $10, and we have exciting packages for every level of donation, including one-on-one call with me, Kevin Ekobedu Taylor, access to some of the documents before they go live. You can also have dinner with me in Washington, D.C. to discuss the issues. But fellow Ghanaians, remember, it's Patreon, patreon.com/withallduerespect. Hi, my name is...
Baby, I know so you go home, yeah. So I could take you to America. And you home, America. And you home, America. Baby, I know so you go home, yeah. So I could take you to America. And you home, America. And you home, America. Baby, I know so you go home, yeah. So I could take you to America. And you home, America. And you dance, America. 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 This country way, everything is different. Baby, I know so you go, yeah. So I go take you to America. And you home, America. And you dance, America. Baby, I know so you go, yeah. So I go take you to America. From Africa to America. From Africa to America. This country way, everything be different, everything not different, yeah. This country way, where everything not different, everything not different. From the road to the food to the street to the house, yeah. Everything be different. Everything be different. Everything be different. From the road to the food to the street to the house. Everything be different. Everything not different. In this country, you go down, yeah, you go down, yeah. These my tickets, yeah. You could tell me you do your wallet, yeah. In this country, yeah, you go down, stop me, yeah. These my words, yeah. You go tell me you do your wallet, yeah. In this country, you go down, stop me, yeah. You go down, catch me, yeah. You go down, stop me. I go down and day, I did my ticket, yeah. In this country, you go down, stop me, yeah. You go down, kiss me, my wallet, yeah. You did my wallet. In this country, you go down, stop me, you don't trust me, these my ticket. You go tell and say, you did your wallet. This country, you go down, stop me, you don't bump this me, I'm on ticket. You did your wallet, the golden menace one. na na na, yeah, yeah. Baby, I know so you go home, yeah. So I'ma take you to America. My new home, America. My new home, America. Baby, I know so you go home, yeah. So I go take you to America. My new home, America. My new home, America. Baby, I know so you go home, yeah. So I go take you to America. My new home, America. My new home, America. Baby, I know so you go home, yeah. So I go take you to America. My new home, America. My new dance, America. 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 This country way, everything is different.
And Science Live, Anastasia and Kitia Emisa says hello, hello Anastasia. Benjamin Kilson is back again. Sir Ankole. So that's it on Facebook. Let's do some YouTube. Let's do some YouTube and see. Let's do some YouTube. The YouTube family is very, very much ready to have a conversation. On YouTube, the family is also alert. My fellow Ghanaians, the family on YouTube, they are way alert. Let's see what's happening on YouTube. Sandra Hetika and her boys. What's happening now? YouTube nowadays, see the way the messages coming in, so cool. These are some cool YouTube thing be crowd they see here. Eh? All right, let's see. Okay, so you two have this new thing, maybe some updates. All right, the Bible University, Kevin, how do I advertise on Loud Silence Radio and TV Network? Please email loudsilenceradio.com, loudsilenceradio.com, and then you will get access to those things. Or Loud Silence Project. Producer, help me with that. Okay. Info. Okay, you can email info@loudsilenceproject2019@gmail.com. Okay, so to make it easy, producer says info@loudsilenceradio.com. If you want to talk to the business desk, just talk to them. The TV side, they're going to talk to you about it. You know, with all due respect, it's a non-profit organization. We don't take ads, but the TV that broadcasts with all due respect, because with all due respect, you know, it's actually on Loud Silence Radio and TV. So you can talk to the TV and they know where to place your ad. So it's an easy thing. They're going to take care of you, my friend. Thank you very much for that message. The Bible University said that Guy Boake, more fire. Thank you very much, Guy. Emmanuel Kofi, welcome. Sandra. Patrick Ingetia says this teacher is hungry. Well, is a hungry one. Okay. William Cab, Kevin, more fire. Give it to them. Samuel Enum Ajete, Kevin, just block that ignorant man. Okay, thank you very much. Adam Kula, mashallah. No. Okay, thank you very much. Wagezi 80 says I'm watching from Amsterdam. D Smash, Kevin, fire them all. Thank you very much. The Bible University is back again. Jamil Ashebo, more fire. Sandra Hetika, how are you doing, Sandra? Sandra, producer wants you to get in touch with him. He wants to know whether you are a blogger or you are a local rep. We want to know, Sandra, please let the producer know. We want to know